concerning the proposed issuance of the county of its airport bond anticipation notes 2020 series, subject to the alternative minimum tax in the approximate aggregate principal amount of $3 million. The Series C notes. Is there anyone on attending this meeting who would like to speak to the public hearing? Before you do, I have a notice that I need to read as per our bond counsel. The proceeds from the sale of the Series C notes will, 1, provide new monies for a capital improvement project, at the county's existing Ithaca Tompkins Regional Airport, the airport, located at 1 Culligan Drive, Ithaca, New York, 14850, and 2, pay all or a portion of the cost incidental to the issuance of Series C notes, including issuance costs of the Series C notes. The project consists of additions, renovations, and improvements at the airport, including the relocation of the existing aviation fuel facility currently located east of Klein Boulevard on the property of the airport to a proposed shared use fuel facility site located east of Warren Road, also on airport property, an expansion to the facility's existing terminal building, apron reconstruction, installation of a new passenger boarding bridge, installation of a geothermal heating and cooling system, installation of overhead canopies with solar panels to be located in the existing public parking lot, installation of additional solar panels on the top of the existing curbside canopy, and construction of a new federal customs facility, all to include site, access and parking improvements, demolition, utility, mechanical, plumbing, and electrical improvements, the acquisition of original furnishings, fixtures, and equipment, and payment of professional fees, and all other necessary costs incidental to such work. The county is the owner and operator of the airport. The county will, at the above stated time and place, which is today at 5:30, place here all persons with views in favor of or opposed to either the issuance of the Series C notes, the location or nature of the project, or the owner of the or operator of the project. If the issuance of the Series C notes is approved by the county, it is intended that interest on such Series C notes will be excluded from gross income for federal income tax purposes pursuant to Section 103A of the Code. Minutes of the public hearing will be made available to the Tompkins County Legislature, the legislature. Approval of the issuance of the Series C notes by the legislature is necessary in order for the interest of the Series C notes to be excluded from gross income for federal income tax purposes. That is the statement. And now I will entertain anyone in attendance who would like to speak to the public hearing. Okay. If there's anyone who I can't see, you're on the phone and you'd like to speak, please go ahead and speak if you would like to. I'll wait just a few more seconds. Okay,
Leslie,
yes.
I was wondering, how did we do public notice with this hearing since people are not allowed in the building?
It was placed on our agenda that went out with call-in information as well as information to log in for it.
And it was published in the Ithaca Journal, the legal notice.
Okay, thank you.
All right, seeing no one, I will close the public hearing and open the regular meeting of the Tompkins County Legislature for today, Tuesday, May 5th, 2020. Please join me in the Pledge of Allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. Roll call of members.
Shauna Black.
Here.
Amanda Champion.
Here.
Deborah Dawson.
Here.
Henry Grandison.
Present.
Rich John.
Here.
Anna Tellis.
Here.
Dan Klein.
Here.
Ann Corman.
Present.
Mike Lane.
Here.
Dave McKenna.
Here.
Glenn Maury.
Here.
Martha Robertson.
She's there.
Martha Robertson.
Here.
Mike Sigler.
Here.
Leslie McBean Claiborne.
Present.
14 members present.
Thank you. Presentation, proclamations, petitions, communications, notices.
They have been sent by email.
Thank you, Kathy. As far as I know, there are no executive sessions tonight and no need to reorder any business or special orders for today. I will go to privilege of the floor for the public. I know there are some folks there. I'm going to call just by phone number, and if you're there to speak to us on the privilege of the floor for the public, please go ahead, starting with 592-1680. The person at that phone number, are you here to speak to us on the privilege of the floor for the public? Okay. Jay Kowski. Are you here to speak to us on the privilege of the floor for the public? No? All right. Lee Dillon, are you here to speak to us on the privilege of the floor for the public? No? And Zora, are you here to speak to us on the privilege of the floor for the public? No? Beth, are you here for a municipal officials report or on the privilege of the floor for the public?
No, I'm just here to observe. Thank you.
I'm sorry?
She's just here to observe.
Okay. Thank you, Beth. It's good to see you online. All right. So no one is here to speak to us on the privilege of the floor for the public. Well, we're glad that you're here observing. Privilege of the floor. No, municipal officials. I thought I saw George somewhere.
Oh, George is there.
Here.
Yep, there you are. George McGonigal, First Ward, City of Ithaca Alderperson.
Good evening, everyone. Can you hear me?
Yes.
Yes, George, we can.
All right.
Thank you
Okay,
for
so-
joining us.
There's some things I'd like to share with you. Last Wednesday, we had a special meeting. Last Tuesday and Wednesday, we had special meetings, Common Council, and at the second meeting, we approved furloughing 87 members of our city staff, their workforce. Probably the worst meeting I was ever attended. City's hurting. I'm sure the county is too. Tomorrow we meet on our regular scheduled meeting, and the highlights of that agenda are as follows. We will be voting to approve $190,000 out of the CDBG CU funds to transfer that to an emergency rental assistance program in the city. We'll be voting on 2 capital projects related to the wastewater treatment facility. And we will be voting to authorize approval and establish fees for small cell facilities, little transmitters for 4G and 5G capability for internet. That's all I have, unless you have questions.
Thank you, George. Questions for George? Deborah?
Thank you, George. I'm sorry that you had such an unpleasant meeting last week. I suspect we'll all be having plenty of those going forward. I'm curious, are your furloughs temporary or permanent?
They're temporary. The mayor's thinking, and I agree with this line of thinking, was that when it became clear that the last batch of federal special funds was not going to include states and local governments, he and the group that it's working on this decided that they would cut hard and hope that things got better and people could come back sooner, rather than pair off a little bit at a time without really knowing, and then having to furlough more people in the near future. So that's the line of thinking. If this next, what do you call them? Stimulus packages? I don't know what to call them.
Yeah, that's what they call them.
Okay. If the next stimulus package sends a bunch of money to the city and hopefully the county too, I think some of these will be reversed. It's huge for the city, particularly the Youth Bureau and GIAC are both hit extremely hard. It looks like neither the GIAC pool nor the Cass Park pool is going to be open this summer.
Yeah.
The Stewart Park youth stuff is not going to happen unless something changes very soon. And the reason these programs got hit so hard is because the social distancing and the coronavirus. You can't have large groups of children together, just like you can't have school right now. So it's not because we don't value our youth. It's because of the nature of this pandemic.
Thanks, George. Let's hope we have better times coming up.
Amen.
Thank you, George. I hope so too. Dan Klein. Dan is joining me in chambers. Go ahead, Dan.
Hi, George. I heard from a constituent who was in the waste hauling business, and he informed me that the Ithaca area wastewater treatment plant is scheduled to be partially closed for 3 months this summer for some kind of repairs. And he wanted me to know that the closest alternative of where septic tank water waste can be dumped is Syracuse. And that this is going to put a pretty big burden on his and other businesses in this area that do this service. I don't have more to say about it. I did contact the wastewater treatment plant and they confirmed all that. And I just wanted to put it on your radar somewhere.
Yeah, that's news to me. We've been talking to the head guy about these capital projects. So you're saying the wastewater treatment plant in its entirety will be closed for 3 months? I don't see how that's possible.
No, not its entirety, but they will have limited capacity to accept trucked in waste, which is where all the rural.
Gotcha. Let me find out about that and I will get back to you.
Very good. Thank you.
Thank you for the heads up.
Thank you, Dan. Henry and then Anna.
Just a second. George, I know that in the last common council meeting, you guys had a discussion about the conference center. Did you have any other discussions about the conference center, or are you going to have any other discussions tomorrow?
Definitely thinking about it, and a number of us are concerned about the future and the amount of hotel room taxes that are going to be available, et cetera, et cetera. We have not talked about it yet because we've been focused on these budget changes. But yes, we will be talking about that. If not at tomorrow's meeting, definitely next planning and development committee meeting.
Okay, thank you.
Thank you. Anna, then Mike Lane. Anna, you're muted.
You're on mute.
Thank you. Thanks, George, for coming. I really appreciate it. I had a question actually from a constituent, and you touched on it briefly, but I wanted to see if you could give a little more information that I can share with her. She was talking about the Ithaca Youth Bureau and actually GX. So Leslyn, you might want to chime in on this one too. I'm not sure, but right now the plan is to the summer camps, I understand, and activities have been canceled for the entire summer. That's correct, right?
Correct.
Yes.
Is there anything that could happen as part of the reopening? For example, if we reach the public health requirements for reopening the region and we hit a point of reopening, this sector, might that be reevaluated, or is that set for the summer?
Well, there's a lot of things that go with the summer camp, like hiring staff, and I suppose there's an outside chance if things switched around pretty soon, but I think it's doubtful.
Right. I understand that there's some like training and protocols and maybe even background checks that need to be done. My understanding was that would actually preclude opening, but I didn't know the exact answer. And before I gave her any information, I wanted to check with you and the city.
So Anna, I would actually really suggest that you ask the person to give a call to either myself and or Liz at the Youth Bureau. surely it's, more conversations that we're continuing to have to see if there's a way to even manage any of it, because it's not just the city. We have lots of other regulatory bodies that we report to.
Yeah.
To make sure that they're all, good with that. So at this point, everything is so fresh that we haven't had more conversation about if things get lifted and the governor reopens the communities, how would that work for us? We still have to deal with, social distancing in some respects, and how do you manage that with, even if we're doing half the numbers of children we have in camp, for example. At GIAC, we have 160 children in camp every day. Even if we go to half of that, how do we manage, social distancing, with that? How many more staff might you have to hire to ensure that, those things are happening? Because regulatory requirements, set us at a place where you can't have children by themselves. So if they're separated, they're, far apart, how do we get, staff to manage that? So there's a lot of thinking that has to go into it. I'm more than happy to talk to, who else. I don't want to offer up Liz, but the folks at the youth group might be able to answer some of the questions too.
I think that what you just offered in and of itself, I can share this video so that they understand the complexity. That will be very helpful. So thank you.
All right, thank you. Michaeline, and then Henry, you still have your hand up?
No, I do not. I'll take it down.
Okay, Michaeline?
Thank you. Dan's comment immediately made me think
I
about
see you, Martha.
the fact that we truck our effluent from our old landfills to the waste treatment plant on a regular basis to be treated. Do we know whether that's going to be limited to, or are we going to have to find another place to send that? Or don't we know? If we don't know, then we got to find out.
I don't know, and I will find out.
Thank you, George.
Thank you, Mike. Any other questions for George? Martha?
Yes, thank you. George, good to see you. On the furloughs of staff, what's that, about what percentage of that of city staff is that roughly?
Between 20 and 25%. There's
Okay.
slightly more than 400 people that work for the city, and we're losing 87.
Okay. On the conference center, I thought that Savante already signed a letter, or it had already moved forward with Vicino. When we voted back 100 years ago, it was February, March, whatever it was, and the deadline, it was like it had to be done then, and it was moving forward. So
Okay.
what is the idea? Is there some way of undoing that? I wouldn't have thought so.
There is a way to undo it. It's probably not a way that most people want to do, but yeah, there is.
Has Savante signed the letter? I think there was, I remember hearing that there was a letter and he was directed to sign it.
I don't know if he's signed a letter. I do know that he thinks we should go ahead with the project. But he has also said that we'd be glad to talk about it more.
Okay. It was just announced today that Anthony Brindisi, congressman from the next district to the east, from New York 22, has pulled together a letter that's signed by, I think every municipal and public official in his congressional district, asking for state and local assistance in the next federal bill. I know that Nancy Pelosi and Chuck Schumer are working on that, and so is Tom Reed. I believe there might be a bill. I just heard right before this meeting. Jason texted me that there's looks like motion today getting something proposed. So I hope you and your colleagues, when we get our letter put together, we can send that and get every member of city council and the mayor to sign on to that. And I don't know, maybe we get every employee to sign on. I think we could get a pretty long list. So I think this is one of those things that just, even though there seem to be many roadblocks continually put up in the way of getting this assistance, I think we could mount a pretty strong public campaign, and I hope you guys will join us on that.
I think that's a great idea, and you definitely don't have to twist any arms in City Hall.
Good.
One thing that Savante, talking about the conference center, one thing he brought up, which be true, I don't know, is that there may be actually more money for things like the conference center as we pull out of this crisis, more startup money, either from the state or from the federal government, which hopefully would make it a better bet, because there's clearly not going to be as much hotel room tax money, certainly in the next couple of years.
Not in the short term, right?
And one thing that's absolutely crucial, in my view, this is my opinion, is for the governor to approve the city room tax that would help backstop this project. The other option, the TID, I can't remember what TID stands for, is not a good option for the city.
The
So,
Tourism Improvement District.
yes, thank you. For a number of reasons, it's a bad idea. So if we're all writing letters, please write to your favorite governor and say you hope that he's going to approve this tax, because he has to approve it.
Did you actually get a bill put in to request that home rule legislation? That would be with Barbara Lifton.
She certainly knows that's what we want.
Okay.
I don't think Common Council actually made a resolution to that effect.
Okay.
All right.
Thank you.
Thank you.
Martha. Thank you, George. Anything else for George? Yeah.
I have one, since we're all at home, I'm dying to know who's got the biggest television set. I'm guessing it's Mike Sigler.
I'm not at home, but I think I have the biggest one in the legislature chambers.
Yeah, we got the biggest one.
We got the biggest one.
All right.
All right. Thank you very much, George, as always.
Thank you.
And good luck with everything at the city.
And you too. We're in
Thank
this
you.
together.
Yes, we are. We are.
Take care, George.
Thank
All
you.
right. Privilege of the floor for legislators. Anyone has anything that they just absolutely have to announce, tell us about? That wasn't a threat. It really was an ask. All right. Thank you all very much. Martha, go ahead. You're muted.
Yeah, can you not see my hand?
I can.
Okay, just to follow up, and we'll talk about this more at the Tiger Committee meeting tomorrow, but I really do think that it's just inconceivable that if every public official, if every local official, every state employee called the White House and Mitch McConnell's office, I can't imagine that we wouldn't get movement on this. And I think it's it's certainly a nonpartisan thing, bipartisan thing, and so I look forward to developing our own letter and getting it shipped around to our congressional district. I know Tom Reed would help us with that as well. So, and the call with Reed is on 9 o'clock on Thursday morning this week, conflicting with Jason's, best and brightest on Thursday mornings with municipal officials. But we'll divide and conquer. So look forward to sharing that letter with everybody and having everybody help to get signatures on it. Thank you.
Thank you. Anna?
Yeah, am I muted? No. Okay, good. I actually, we have some staff people who are watching this Zoom, which is fabulous. And one of them, Janice Johnson, shout out to her for being so on top of things. She sent an email saying that there's going to be a Zoom conference with the health department on Thursday at 1:30 about camps in the meantime. And TCYSD is heading up a task force to see if smaller camps can increase attendance to help cover some of the kids who are or would attend IYB and GIAC, the Youth Bureau. And of course, that is if camps can open at all. And I just wanted to give a shout out to Jason and the health department and Leslin and GIAC and Ithaca Youth Bureau for all working to make that happen. If it's possible, that would be great. And if not, I think more importantly that you guys are trying in every way to support families. So I just wanted to say thank you for that and acknowledge that. Today is Teacher Appreciation Day. So I just wanted to give a shout out for everyone, for teachers. I actually just got off the phone with one of my favorite high school teachers for a while, which was a very inspiring phone call. So if you are inspired, call your favorite teachers, tell them they were fabulous, why they changed your life, and I'm sure they will appreciate it. And the one piece of information that I have gotten a lot of reach out, I don't know if other legislators have as well, but people who are still having a hard time with unemployment, that they get through the online portion, but they aren't getting the call back, the phone call. And I just wanted to share with everybody, so this is on record, that Jackie Miliese reached out, or I reached out to her and she responded. She is the director of the Tompkins County Workforce Center. And she has a connection with the state, with the Department of Labor, and has been helping me one-on-one connect people who are having really difficult stories and a very difficult time getting through. So if any of you have constituents that are having difficulty who reach out to you, I highly encourage you reach out to Jackie. She's been an amazing resource.
Thank you, Anna. And I did fail to mention that today is also in the spirit of multiculturalism. It's also Cinco de Mayo. So happy Cinco de Mayo, everyone.
Happy Cinco de Mayo.
I'm not going to say what I expect you to do after the meeting, but happy Cinco de Mayo. Thanks, Anna. Anyone else? All right. We're going to move on. Before I go to the county administrator, I do want to say very quickly, last week, with all of your support and blessings and help with crafting a letter sent out on behalf of all of us to our county staff, because this has been so difficult for everyone. We're experiencing it, and I can't imagine what is going on for them as staff members, still trying to maintain services, as somebody who works a 9 to 5, I know how difficult it is. Even some of the questions tonight being asked about how do we support families over the summer. So thank you all for chiming in on the letter that went to county staff. I do want to take this moment to acknowledge that many of them responded back to the letter to me, being very appreciative of the fact that we're paying attention, that we care, and that we took time to acknowledge how difficult it is for them at this time. COVID-19 hit, and in as much as we all were running around in response and trying to figure out what to do next, our staff continue to let this county function as smoothly as if nothing had really happened. People are still, getting services, even if it was having to call instead of just showing up in person. I think the county was probably the last to say we're physically going to close our doors to the public as a big employer for the safety of everyone. And so I want to thank our county administrator and our staff, our frontline staff in particular, who are there doing that work, who are continuing to make sure needs are met, who are continuing to answer the phone calls and the emails, in numerous emails and phone calls that are coming, because more and more people are realizing different needs every day. So I want to acknowledge all of you legislators for taking time to recognize and appreciate our staff, to acknowledge the difficulties we're all facing right now, and understanding even that there's still more to come, that we're not fully out of the woods. We, having conversations talking about furloughs, as you heard George say from the city end. I know personally how hard that is. I almost said to George that you're making me relive the trauma. I'll send him my bill, but I do want to take time to not only shout out, but lift up our staff here at the county who are doing yeoman's work, who are adjusting ably to the changing conditions and changing times, and trying not to skip a beat in providing services to folks, whether it's mental health services or a need for food or a need for, just somebody to listen. All of those things continue to happen. So I really, really want to take this opportunity to publicly, yes, we sent a letter and yes, they all responded. But I want to also publicly just acknowledge how much they have been doing, how much they've been ready to do some switch thinking and switch operations at the drop of a dime because we need to, and how much, knowing how much our public depends on us even more so now. So thank you, and thanks to all of you legislators as well for continuing to share information and bring questions, et cetera, so that people get their needs met. So again, thank you. I just wanted to take time to say that. Moving on. The county administrator.
Thank you, Leslie. We have two reports today. One is going to be a COVID report, similar to what we've done in the past two meetings. And then the other would be a mid-year budget review report. Let me just see if I can get this. Everyone can see that. So here is kind of a timeline report. What we've been doing over the past two legislative meetings is we have been adding these reports or these slides to a timeline that's on the public health webpage. So you can see from the first one, and then every one we give subsequently to it, we add to it. So it's one long timeline. And what we're doing is capturing week by week or every 2 weeks some of the activity, so that if anybody wants to review how this has gone over the past really 6 weeks, you can see the timeline of it. So here's a capture of April 22nd to May 5th. There's a series of changes. If you go back 2 weeks ago, 2-3 weeks ago, the state was in its peak. I guess the key word at that point was apex. We remember that. And that they were having, the highest streak of hospitalizations, ICU submissions, and unfortunately daily death rates. And now things are starting to scale down. We have seen a similar scale down a little bit earlier, but we are to about a total of 133 positive cases. Only 10 plus in the past 14 days. We have gone several days also without new cases, which is a positive sign that we are at the tail end and starting to manage the disease. Several executive orders that came out, testing criteria expanded to include essential workers. That's not requiring them, but opening the door to additional criteria. So you no longer needed to be symptomatic or be in contact with a positive case. There was an announcement made with respect to a reopening plan, but not really in much detail. We're starting to get that throughout the week, late end of last week and early this week. And I expect we'll get more in the coming weeks, coming days and weeks. And then schools and colleges remain closed through the academic year. That was also announced. County operations, we began a mask making effort. You can see we've already produced about almost 700 as of a day ago. And then also a lot of other masks that have been donated through these blue boxes that are located throughout the county. We pick them up daily and then bring them, they get dry cleaned and then redistributed to essential workers. This is in addition to 37,000 masks that were donated by the state or given to us by the state. And then this week we've started to get other direct deliveries of masks to individual departments through different agencies. Not as coordinated as in the past, but these are being distributed for those certain constituencies, whether it's COFA's got some, et cetera, et cetera. So they're continuing to be distributed. In response to the executive order allowing the testing criteria to be expanded for essential workers, we issued a policy internally to allow county employees 2 hours of excused leave time to get tested. If they so choose. We're not requiring it as an employer, but they can do so if they feel it's appropriate and they work out that scheduling with their supervisor. Because testing is only between 10 and 3, we're allowing some leave time for that to happen. We did convene a meeting with some community partners to discuss reopening concerns in preparation of getting questions or being able to feed those questions to our state partners, which we have done. The EOC also has begun planning for what we would call a reconstitution of county operations. So as we did COOP planning, which was a continuity of operations, we're talking about reconstitution planning. And today we issued some guidance to department heads to start to document and plan out initial thoughts about how reopening would work based on the information we have. And we are going to have a very thorough process in the EOC to review that and to ensure that we sign off on it before any department has the ability to reopen. And the whole EOC team, including Frank Cooper, our public health director, and I will be part of that review process to ensure our employees are safe, as well as our customer and clients are safe as well. That could also span from weeks to months in terms of reopening, depending on each department. It also depends on what type of guidance and state and authority the state authorizes us to open under. So it's an early starting process and the planning process, but an important one. And unfortunately, last week we contacted and we'll talk about this later, over 90 employees, almost our employees, about some temporary layoff notifications. We've also had a brief conversation with our higher ed partners about what their needs are and concerns they have about reopening, so we can also relay that to the state. Important communicating. Our public health director had also joined a panel for the chamber to give some updates. I did a virtual Q&A with staff last Friday. I think it was well received, got a lot of positive comments. We're going to do it again this Friday as well, getting 20 to 30 questions, which is good to get good feedback on. Frank also did another PSA about staying home, and he's also done another radio panel. He and I are doing another one next Monday as well. So like I said, all these slides will also be added to the main one. So we're going to shift gears a little bit in terms of update. I'm going to turn this over to Frank to give a little bit of a description. But what we've done here is we put together some demographic information and wanted to share that information. It's been asked before, and I think we're at a point now where privacy is not a concern to the existing, to the positive cases and the patients. So Frank is going to go through some of the demographics, and we have a few slides just to give some categorization and demographics regarding positive cases that we've had today. Frank?
Great, thanks Jason, and good evening everyone. Jason gave a good lead into this. We are at a point where with our 133 total cases, we feel like we're able to provide a composite of demographic information. I know folks have been asking for this from the beginning, and as we've said, we had concerns about privacy, but also the impression that small numbers and the way the data was distributed could give a false sense of security. And I think what you'll see as we go through this data, we were on target with the idea that our entire community needed to take steps to protect themselves. So I also wanted to add, we've made a footnote on this because it's public now, We're not going to be updating this with each new case. That's not the intention of this, because that could potentially get us back into the privacy issues. But it is our intention to update this as the numbers allow us to do in a fashion that wouldn't impact privacy. So just wanted to make that clear from the beginning. The information on this slide demonstrates the age distribution across the 133 cases that we've had to date. The blue columns is the percentage of our population as a whole, and then the orangey red columns are the actual percentages related to COVID positive cases. So as you can see, in most of across the board, the positive cases align with the age distribution. I think one takeaway from this that we've been saying for a while is that it's not just a senior resident type situation. If you look in our age 20 to 29, and 31% of our cases were in that age group. So we do know that young people can get the disease and can serve as transmission vectors. So these numbers kind of prove that out. And if you look at the totality of it, between 20 and 69 is where the bulk of our cases age range lie. And those folks that are over 70 or under 19 were a very small portion of the total cases. So this, and then on the bottom there, it gives you the actual number of cases under each age range. So folks don't have to necessarily do the math from the percentages. But it is interesting to see the distribution is across the age ranges. In most instances, it aligns with the percentage of our total population. Next slide, Jason. So this slide is the race distribution. So same thing, in blue, we have the total population in each of those categories, the percentage of our total population, and then the positive cases that are associated with that. And in this group, even more so than the other, the positive cases almost align pretty directly with the population numbers that we have. So as you can see, in folks that identified as white, that is the majority, the significant majority of cases. And then you can see the other races there. I would point out that these are self-reported, obviously. So this information is collected during our contact investigations. So it's up to the individual to identify how they feel appropriate related to a race question. And again, along the bottom gives you the actual counts under each of those categories. This slide talks about the source of exposure. So this is another question that we've gotten a lot. We talked about a few weeks ago when community spread became known to us. As you can see here, it's almost a split. An even split between those who have been exposed to a positive person versus those where we were not able to identify their exposure route. Obviously, if you had looked at this number 3 weeks ago, 3.5 weeks ago, it would have been skewed more to the known positive. And as time progressed, we had more and more cases where we were not able to identify the known exposure route. So again, on the bottom, you can see the actual numbers associated with that. And the last slide as far as demographic information. So this is the map. Folks have been asking about municipalities. And so here you see the distribution. Almost every municipality in the county has been impacted. The village of Dryden being the only one with 0. And I won't point out that a certain public health director lives in the village of Dryden. So not that that has anything to do with the number there. But we have a distribution, right, that makes sense. The most densely populated areas, the city of Ithaca, the town of Ithaca, have the most cases. And then we have much smaller numbers in the more rural parts of the county. But there is really no untouched part of our community. in the distribution. So this is what we know of the 133 cases that we've had to date.
Okay. There's another part of this presentation, but if you want to ask any questions, you want me to go through the rest of it as a few slides, or we can ask Frank?
Let me just take a pause and see if there are any questions.
Sure.
Oh, bragging rights, Frank.
Leslie, I've got my hand up.
Yeah, we're just pulling you all back up. We couldn't see you.
Oh, okay.
Go ahead,
Sorry.
Martha.
Thank you. Frank, that the age distribution is actually quite surprising. I mean, you look at, and I really appreciate that you've got it compared to the distribution in the population, where, and this is one of those messages that is really frustrating, that from the beginning, people have been saying older people are more vulnerable. I think the truth is older people are more at risk of getting sicker with it. When they get sick, they're going to have a worse course. But they're not, I don't know. It seems like the younger, ages 20 to 29 is really out of sync of their, the population. So it seems like that's, you know, those are the folks who have been led to believe that they're invulnerable. Like, well, of course they always think they are, but they're led to believe that they're less likely to be at risk and they're not as careful. What do you think about, do you think there's anything to that? I was struck at how that, it's a few slides back. If you want to take, if you can.
Sure, well, they're moving the slides back. I think how you described it is pretty accurate. We've been talking about vulnerable populations being our senior citizens, those over 65. And the reason for that is the complications and severity of the disease are more significant for that age group. I think we've tried to make our messaging clear that anyone is susceptible to contracting COVID-19, and more importantly, anyone is susceptible to transmitting it to others, and hence the need for everyone to stay at home, even when the most at risk population is much smaller. And quite frankly, when I look at those numbers, to me, it looks like the work that we've done as a community to stay home has protected our most vulnerable citizens. To see that those numbers are that low in that group that could have the most severe reaction is heartening. And it shows that the efforts that we've taken were valuable and really did protect those that were most vulnerable.
Yeah, I mean, that's really striking. I hope we can maybe really highlight this on our website and in public messaging. Because I wrote to you and Jason earlier that I was out on Sunday and I saw no masks on the Cornell campus and only a few downtown. And I was just, it just really seems like, and I've heard that from other people too, seems like people are still delusional, I guess. So I hope we really make this a big point that anybody can get it. Thanks very much.
Thank you, Martha. Henry, and then Ann.
Yes, thank you guys for this information. I mentioned before that the U.S. was not taking a split between genders. Do you have gender information?
I don't. I'm trying to think. We collected it. We did not pull it. I do believe it's close to 50-50.
Okay.
But we can circle back on that and see what we have.
Okay, thank you.
Thank you, Henry. Annie?
Thank you for all this information. So first off, I just wanted to make sure that we were going to, as legislators, we were going to get these all the slides that were provided today. because I'd like to ask that, because sometimes we're provided with them and then sometimes we're not. And wanted to know about this data too. Is this going to be posted anywhere publicly?
Yes, it'll be posted on the county website with the other timeline information, and we can distribute it to everybody.
Okay, great. And so one question I had was regarding the percentages, and so like, for instance, go to the slide with the age percentage. So I'm just wondering here, so let's take the first age group, 0 to 9 years old. So is that, for instance, so the total population of people in that age group is 8%, and then 3% tested positive. Does that mean that of all the people who tested positive, 3% were in that age group, or is that somehow changing that to change that to what percentage of the population that group has?
And it's the percentage of the 133 positive cases that were in the age range 0 to 9. So in that category, and you see the number below, 4 people age 0 to 9 out of the 133 were 0 to 9. So 4 people out of the 133 that were positive were age 0 to 9, and that's 3% of the total 133. 8% is the percentage of total population that is in that age range 0 to 9.
I'm still not clear, so I just want to make sure that I understand this. So the 8% is the total, the 8% of people that got tested were in that age group?
No, total population.
Right. So, so if there was a different age percentage, a different proportion of the population that got tested, then, so I guess I'm not understanding the relevance of this.
The point that we're trying to demonstrate with the total population is the distribution of cases in our total cases is reflective of the demographics of our community as a whole. So we could call out if there were any disparities in certain groups, whether it be age, race, what the other thing was we measured. But it's really about looking at our total population and then the percentage that tested positive to make sure we didn't have any disparities.
I guess I'm just wondering, what does this tell us if we're not going by, for instance, if we had 10 people were tested in the 0 to 9 group, what percentage of those tested? I think that for me would give me a different set of data versus I don't know if more of the people tested were in the 20 to 29 group versus very little were tested in the 0, the lower age group. Does that make sense?
It does make sense, and it would be another data point. The purpose here was to give a demonstration of the characteristics of the 133 positive cases, and then compare those characteristics to the characteristics of our population as a whole, again, to see if we had any disparities. Certainly there's more data that you could dig into, but the purpose here was to give a general picture of the demographics of those that have tested positive.
Okay, so maybe possible. So this is good for now. You know, I appreciate this. Maybe later on, say for instance, if we're testing in a nursing home, you know, what percentage of those people tested in a nursing home might be good to find out, or if we're testing in a certain any certain area.
Thank you, Annie.
Thank you.
Go ahead, Frank, what were you saying?
I was just going to say, we're going to continue to evaluate data, and whenever it is possible for us to share specific demographic data that won't interfere with the privacy of individuals, we will try to make that available.
Thank you. I really appreciate you all responding with the information you're sharing now. Henry.
Yes, Frank, I just want to know, follow up on Annie's question about a sense of, I know that they did the nursing home testing late in the process. Do you have a sense of how many nursing home patients have been tested yet?
I think we're about a third of the way through the nursing homes in the community. We're not talking publicly about which ones have or haven't, but we understand that there's testing there. Again, this is reflective of positive cases only, not total tested.
Okay, thank you.
Martha?
Thanks. If I can back to the age split, if I can see if I understand this correctly. So Frank, if there were no characteristics of people's behavior or exposure that was different for different ages, you would expect the orange line bars to be the same, almost exactly the same as the blue bars. But what this shows is that whether by exposure or behavior or probably both, 20 to 29 is really disparately at risk, disparately showing up as positive, and also 40 to 49 seem to be the biggest discrepancies there.
The only caution that I would offer is we are talking about 133 cases.
Yeah.
Right. And so drawing too many very specific conclusions about this data is dangerous. Right. I think we have 100,000 plus residents in our community, and we're talking about 133 of them. And so if this isn't meant to be statistically significant, it's really just meant to give a demonstration of the proportion of disease within these particular demographics related to those 133 cases. I think you're absolutely right that younger age group, we probably need to continue conversation about their ability to be a transmitter because they are getting the disease. But to draw any further conclusions beyond that, I think would be risky.
Right. So and by comparison, the race slot breakdown, the blue bars and the orange bars were much closer together.
Go back to that one, Jason.
Right. Can you go to the next one?
Yep.
So there's a little bit of difference there on white and Asian, Hispanic. Not exactly, but they're much closer together.
Yeah, I'm making no offers about whether or not these are statistically significant different.
I got it. Yep, I understand. All right. Thanks a million.
Sure.
Anyone else? Any of you still have your hand up? Or you just forgot to put it down? Thank you all again so very much for sharing this information. I know that, legislators, and I appreciate legislators' patience, in us getting the information. More than anything else, we need to continue to push the message. Our numbers aren't very high, but still we want people to be practicing all of the safety precautions that our health department has put out and what we're expecting people to do: wash hands, wear a face covering, stay home. We want to continue to push that message. It's getting nicer out. Martha, you're right. I'm seeing people out all over the place, no mask, no coverings. And so we just have to push the message. Speaking of that, Frank, I have a question for you. Today I was in a meeting and there was some confusion for folks around the whole mask wearing. People understand the message to be wear a mask if you cannot practice social distancing, if you can't do the 6 foot distancing measure. But there's more concern about people just wearing a mask in general, and should the messaging be about more of that than the one with the caveat? That was a question that came up. So for example, folks talked about going for a run, you know, and you think you'll be the only person on the trail, but then somebody else is, you know, running past you and they're panting and everything else. No one is thinking that when I go for a run, I can't practice, you know, that level of distancing. So the question came up about whether there should be less confusion about the messaging. And I just wanted to raise that with you while we have you here, and more about just encouraging people to wear a mask, period.
Yeah, it's a good question, Leslyn. And you know, the message is generally we want people to wear face coverings. The 6 foot separation is kind of the number that we use from a perspective of where we think the most exposure could occur. I think the challenging part is that, using your example of going on a run, you know, you may leave for your run thinking, oh, I'll be able to be 6 feet away. I'm going on a trail. Nobody else is going to be around. But you never know if somebody's going to be there or coming the other direction. Same with walking on a sidewalk, right? You might be walking on a sidewalk and get all the way where you're going and never see another person, or you might pass people, and it might not be possible to stay 6 feet away. So the similar thing in a building setting, right? You may say, well, I'm an essential worker. I go to my office, I sit in my office, nobody's around. While you're sitting in your office, you probably don't need to wear your mask. But if you get up to go to the bathroom or to go to a break room or something like that, you don't know if you're going to run into somebody else in the hallway or in the bathroom or the break room. And so having your mask on prevents those unexpected exposures. It is a challenging thing. This is new for all of us from a behavior perspective. And wearing a mask every time you leave your home the entire time is going to be challenging for people to achieve. So we want to be as clear as possible about when it's appropriate to do. And I guess really the main message is, when in doubt and you can't ensure that there's no way you'll bump into somebody, you should probably have a mask on to prevent those exposures.
All right, well, we'll try to make that message as simple and clear as possible. Wear a face covering. Because if all of us is thinking, I'm just going to run on the trail, nobody else is going to be there. And then Rich is thinking, I'm just going to run on the trail, no one else will be there. And Sean is like, yeah, I'm going to the trail, no one else will be there. Guess what? We'll all end up on the trail with no mask. So simple message, have your mask, wear your mask. I can live with that. Thank you. Anna?
You're muted, Anna.
Shift Command.
You're muted, Anna.
It's really hard when I can't see you all. Go ahead, Anna. We unmuted you, but you muted yourself. We're going to unmute you, Anna.
Yeah, when it is in the presentation view, it's really tricky to figure that out. So am I unmuted now?
Yes, you are.
Okay, so I wanted to I guess second what Annie was asking. I really appreciated, which was the vigorousness of the testing, that if certain age groups there's more vigorous testing or less vigorous testing, that could influence that those numbers. And I understand, Frank, that there's a lot of testing that's happening, for example, in Longview and other nursing homes, and there are, I think, like over 700 outstanding tests. Is that true?
Correct. I don't have the chart in front of me, but there are significant outstanding test results today.
Right. So that, because they have been oversampled, that would certainly influence potentially the distribution simply by the nature of the level or magnitude of the sampling in that group, different from the other groups. So I do definitely appreciate the adding the statistics of the age distribution of testing. There may be some groups that are less or more likely to seek a test. And that would be, for me, my concern of those that got COVID, but just, didn't get tested at all and waited it out. And maybe it'll give us a sense of that. So that would be great. And thank you so much for talking about the significance of this. 133 is definitely wide confidence intervals, so we wouldn't be able to really get a sense of any of these being statistically significant. The other thing that would be great, is it possible, because we've been dealing with prevalence data up to now, to do some incidence data, because I feel like that would give us a sense of whether we've actually reached the peak or crossed the peak. I mean, it seems very much so that we have. And I understand from the beginning, 10 of the last 14 days, there have been no new cases. Is that the case? Is that what I understood from that first slide that Jason presented?
Yeah. I say that with all the confidence of that pause. I know the last 4 days we have not had new cases, and there's been several cases at several days where we haven't had cases over the last week or so. So we've had one new case in the last 7 days.
And the reason I bring that up is because I know other legislators as well have been getting this, is that the question that I've heard, and I have as well, is that, they want to see our curve and the extent to which we've flattened it. If we could chart the incidence rate of new cases over time, it will show a really dramatic flattening of that curve and a decline. From what you've just said, that might be the most dramatic way of showing the intervention that we've successfully done in this county. So just thought it would be a good graph to add.
All right. Sure. Thank you, Anna. Thank you very much, Frank, Jason, members of the EOC. Thank you all for that information. I know legislators have been very patient, and these guys are working hard to provide information. And I'm sure some of the things that you're just asking about will, come at some point as soon as we're able to gather that information and put it in reportable form that, again, still protects, privacy and confidentiality, et cetera, et cetera. And this information will be up on the Health Department website, so you can direct folks to it to check. I know people have been checking it often, but we'll have this information up as well, and I'm sure there'll be more questions to come about it. So thank you again for shedding some more light on what it looks like in our county.
There's a few more slides just on this report. Just to talk a little bit here. This was an update of what we've done over the past few weeks, just to show you number of hours worked on COVID, cumulative hours, number of folks that had claimed emergency leave, and then total amount of value of those hours. Again, amount of regular hours worked on COVID-19, over 20,000. Overtime hours is 2,600, and then the different values in terms of regular pay versus overtime pay and comp time pay. Again, overtime pay is probably the only thing that would be reimbursed right now. And then this expense down here, notable expenses include about $40,000 worth of expenses. Regular hours, most likely not paid because those are hours that we would normally pay employees to work. This just, we'll update this every pay period just to keep a running tally of the costs related, just the personnel costs related to the response. This is an update of food distribution. We did have a prior food distribution slide 2 weeks ago. We did not update that one, but we did include this. There was a TC3 pantry food distribution on April 24th. Good chunk of families, 450 families received 50 pounds of food. 60% of the families were new to the food bank. Baby formula diapers were also provided, and some county employees did help with the distribution in certain instances where folks could not pick up those food. Oops. Here is a little bit, the next two slides are going to talk a little bit about what the governor announced yesterday with respect to reopening guidelines. And so this has been a little bit of a challenge. We're getting a lot of questions about what does reopening look like? What are the steps that have to be taken? The governor last week talked about a phased approach that had very little information, a little bit more trickled out. And then yesterday we got a lot more information. Still very vague, but basically last week he had talked about 12 specific points that are topics that would need to be included in a reopening. Well, yesterday he talked about 7 specific criteria that would have to be, that a region would have to meet in order to reopen in a multi-phase process. And this is a slide that's from the press conference that he held yesterday. Basically, the criteria, which are primarily healthcare, hospital-driven criteria, 14-day decline in hospitalizations or under 15 new hospitalizations, a 3-day average, 14-day decline in hospital deaths or fewer than 5 deaths, it's 3-day average. New hospitalizations, 2 per 100,000 residents, a 3-day rolling average. Share of total beds available, threshold 30%. Share of ICU beds available, threshold of 30%. 30 per 1,000 or 3% for every 100,000 population tested. And then also at least 30 contact tracers per 100,000 residents. So as you can see, there were 5 regions, and these are the same regions as the economic development regions, but these regions are categorized this way. We're in the southern tier. So as you can see, I want to say that all of this data here from the first 6 of them are all reported daily by the hospitals through a system that they have that the state gets the data from. So this is really nothing that we report on per se. It's something that the state gets from hospitals and it's reported to them and through a series of sources. And in this case, the one we do report on and we do have influence over, which is the at least 30 contact tracers. Now, in this instance, Tompkins County ourselves, if we were just doing this on ourselves, we do meet all the criteria. The CMC's drive-through testing location definitely comes close to exceeding the daily number of tests that we would have, or monthly tests. And then we do have 30 contact tracers for 100,000 residents. So we do have the ability, but we are also looked on as a regional approach. So right now, all the 5 regions, as you can see here, Central New York, Finger Lakes, Mohawk Valley, North Country, and Southern Tier, all of them are coming up short in the same 2 categories, which is tested per month and at least 30 contact tracers per 100,000 residents. Now, there was not any direction given or clarity given to shortcomings that come with the capability of testing, shortcomings that may come with contact tracers. I was on a conference call yesterday with all the counties, with the division, the director for the division of budget for New York State and a special advisor to the governor that talked about a variety of these issues. One question brought up by one of the counties is the state expecting the counties to hire contact tracers? Is the state going to hire contact tracers? Does it mean we have to have them hired, or does it mean they have to be available to them? None of those questions were answered. Also, the testing is another question of, if you're not requiring testing to be taken, it's not a directive. How do you ensure it? How is that testing going about? Who's to pay for it? All of those things were unanswered, but the state openly acknowledged that this is a work in progress in terms of answering some of those questions. But these are the 7 criteria that the state thinks that at least a good portion of the regions can meet in the next 10 days. And that will go to phase 1. And I'll talk about what phase 1 includes in terms of what business industries could open as part of phase 1. So there's some questions. Maybe I'll take the questions on this slide before I go to the next one.
Yeah, I see Rich and Anna. Rich?
Yep. Thank you, Jason. I was just wondering if all these criteria make great good sense to me, and certainly dividing the state into regions makes sense as well. But I'm thinking we're going to need dramatically greater testing capacity if we're anticipating a ton of students moving in and out of the community. Are we making special plans to far exceed the testing numbers that the governor's been talking about? Thanks.
Yeah, no, it's a good point. They're separate but connected questions, Rich. So the question of just regional testing in general, because of the CMC drive-through facility or site location, we definitely have the ability to support the region. I don't think that facility can carry the region. And I know that there's a state open drive-through testing sampling site in Broome County, but there definitely needs to be some more access to it, which the state recognizes there isn't. So it's a resource issue on top of it. That aside is the question about higher ed. We've had some preliminary conversations with higher ed along with CMC about, you know, if they were to return students, is testing a requirement of those students? Is testing a requirement of all those that are coming to campus? Those are all questions that higher ed is reviewing and trying to answer as they go through their planning process. So, you know, it's the question of capacity and ability to do the testing. We are definitely atypical here because we have a great resource where a lot of counties and regions just don't have that capability. So it's something that the state recognizes with answers to come, I guess I would say.
Thank you. Anna?
Thanks. That was very helpful. I would follow, I had another question, but I wanted to follow Rich's up. Is there conversation with the colleges and the health department? Is there a collaborative effort to create protocols for any kind of reducing any risk of any resurgence when the students come back?
Sure. So we facilitated a conversation with all higher ed institutions. All three of them were there. Frank was part of the conversation. I was, Amy was, to start the joint conversation and share information about what, you know, they're all going through their own individual planning process, but start to open up the dialogue amongst all of us, because our role in this, regardless of who's doing the sampling, and that could be CMC, it could be the university or college themselves, it could be another entity, that we need to be part of that conversation, because from a contact tracing perspective, any positive case comes back to us. The public health department does the contact tracing, does the background, and then works collaboratively in certain instances, depending on circumstances, with ensuring the individuals in isolation and that there's other mitigation efforts that are taken. So yes, the dialogue is open. We've facilitated those conversations. We'll continue to have them with them. I think I mentioned this before. It's obviously an important priority for us to ensure that higher ed has all the information they can so that they can make a good informed decision come this in the next probably few weeks to determine if they're going to have students come back in the fall. So it's an ongoing conversation with them, and they have been participating.
And my other question was about the choice to do this regionally. I'm assuming the choice to do the opening regionally and requiring these public health protocols be met or guidelines be met before it is to reduce spread in an entire region. Of course, my concern with this is that if Tompkins County meets all of these criteria already, and we meet them for a while, and the region itself is not meeting it, has there been any discussion at the state level of reconsidering allowing county by county, if there's, major steps being made in one county? Because I would hate to see that, us not able to move forward and it not be under our control at all. I understand that we have 15,000, or we did have a lot of in-commuters. So of course we're impacted by the region, but I just wanted to hear your thoughts on that and whether you've heard anything from the state.
I have not asked the question. It's definitely something we can ask if we don't see progress being made. I think our first approach is the understanding that the regional approach is probably the right approach. The state recognizes there's a lot of work they have to do because we're asking for a lot of guidance and structure, which just doesn't exist now. And I think it's a question we can ask if we need to. For the time being, we're participating with the other county administrators and county execs to assemble this information. I've shared the resource we have. Frank, through the public health directors, has shared, the resource we have from the testing capability. So everyone knows about Tompkins County. And interestingly enough, there's two other regions, I think, that touch Tompkins County, Central and Finger Lakes. We've definitely benefited the region in terms of the testing capacity. It's a question, honestly, I don't know that the state's going to entertain it, but it's something that we can keep in our mind if we just don't see progress moving. For the time being, though, we're going to work with our counterparts and try to get everybody into a place where the region can open collectively. But, the state recognizes there's inconsistencies across the state, which I think the regional approach is probably the best way. They're trying to get most similar areas together on the same page.
That sounds right. Something to continue to track.
Yep.
Thank you, Anna. Martha, and then Henry.
Thanks. I was going to say about, I guess Cortland is in the central New York, and Cayuga is in Finger Lakes, I think. Is that right? And I would think that we need to really be in touch with them, even though they're not in the region, just to make sure people back. We're definitely going to be affected by how they're doing. Now, on the issue of us serving other counties, that's great. On the other hand, we were all worried about people not being able to get from downtown up to the mall, so to the testing site. So I would hope that, I mean, really every county should have a site. It's hard for me to figure out why that wouldn't be the right move. And I think that, in the last federal bill, there was $25 billion allocated for testing. I don't know where that's going and how people get it, but maybe that's an area where we should be trying to do some advocacy too. Because it's this a black hole. I mean, nobody knows who's in charge, and it's sort of this seems to be not much better than the morass at the federal level.
Yeah, the issue of sampling and sampling resources, both the kits, the staffing, and the PPE are the hindrance to any of these mobile, or I wouldn't say mobile, but drive-through sites being set up. It's been a challenge. We were fortunate to have, Cayuga Health Systems that took the lead on it in our community, and they acted as a regional resource. But the state is dealing with the same challenges that most hospitals have had trying to set this up. Remember, we did not set up the drive-through site. That was Cayuga Health Systems. We just happened to be a beneficiary, and Cortland and Schuyler and the adjacent county also happened to be a beneficiary of it. But this is a challenge. The state recognizes, they've acknowledged it's a challenge, and they're trying to do all the thing they can to set up the resources, because if they're going to have this be, there is concern that if this is a threshold of criteria that they set, but it's an unattainable one, then they need to help us achieve that criteria.
I mean, I understand we're just one little part of a big system. I guess, is it conceivable that the county health departments, we don't need to, but in other counties, could county health departments be the actors and take this on?
They could. I think you'll find that the Tompkins County Public Health Department is a little more robust and capable, a lot more robust and capable than our counterparts across the state. Most of them don't have a fully funded program like we do. They don't have the contact tracers. They don't have the public health nurses, community health nurses that we have. I think you'll find that most public health departments are underfunded, understaffed, and are scrambling. I mean, just for example, we were able to help out 2 partner counties, both in Steuben and Livingston County, with just sample kits, but and that's because the state couldn't get them sample kits.
So I know we would love to fix everyone. We can't.
And my colleagues love it when I talk about this too, yeah.
We can only do what we can do in Tompkins County.
All right.
Okay, folks, I'm realizing it's going on 7 o'clock and we still have a full agenda ahead of us. And Jason still has another presentation for us. So let's get crispier here.
Henry has a question.
Henry, your hand up?
Yes, it is.
Okay.
I was wondering if, since it's the Economic Council, have we had any meetings with that Southern Tier group?
So just for clarity point, the Economic Development Council, the regional council, is not the entity overseeing this.
Right.
It's unclear at this point what that entity is. Maybe that's a good lead into my next slide. And that is, the regional, right here, this regional control room was talked about in the requirements of a reopening. And the regional control room has yet to be defined as to who would be appointed to them, how they would be appointed. My understanding, and what the governor cued yesterday, was that there would be local leaders, county legislators, city officials, town officials, village officials that would be appointed to this control room. That guidance hasn't been given. And that's part of the challenge with the state right now, is there isn't a clear structure as to who's organizing this. So one of the county executives from Chemung County, Chris Moss, reached out to the county administrators and county executives last week to just gauge an understanding of what our capabilities were. We got on a quick conference call. We shared our capabilities. We're going to meet again tomorrow to talk about our capabilities and then summarize some of that. But in the absence of clear direction from the state, the information that was on the prior side is being reported to the state by the hospitals. We're kind of trying to understand and waiting for clear direction as to how this information is passed up, and then how ultimately the decision is being made. And what is the role of this regional control room? That no one really knows yet. So let me just go through this slide real quick. This is the 12 or so kind of elements of reopening. Here are the phases that when you hit those criteria that I just described in the last phase, in the last slide, these are kind of the phases of the industries that would be opened by priority. So the first one would be construction, manufacturing, wholesale, supply chain, and select retail using curbside pickup only. No description, obviously, still they're working on it, but this would be phase one. Assuming there's a 14-day maintenance and continuation of those 7 elements or criteria we discussed on the last slide, you would technically or could go to phase 2. And then after 14 days to phase 3, after 14 days to phase 4. Obviously, there's a lot more description that has to be put in these phases in terms of industries. This is just the tip of the iceberg. And I'm sure they'll do it, have a tough job defining them all. And then obviously there's these other elements here that are undescribed right at this point in time outside of these criteria, these elements here. So the state, I'll just say again, the state has been proactive in terms of acknowledging that there is a lot more work that has to be done in a very short period of time. Our messaging has been to our regional reps, we are continuing at the very least to have some dialogue with our community about questions they have, not putting plans in place per se, but questions they have so we can relay them to our folks at the state, which we've done. We're having the dialogue with higher ed to make sure we're facilitating the conversation because higher ed is a major industry for us. And we're standing by waiting for that direction. One thing that's not on this slide that I'll share, and it's on the governor's webpage, is that they did identify 7 points that should be going into businesses' replanning or organizations' replanning. It focused around density, it focused around office spacing, and they acknowledged that they are working on defining those parameters clearer as they move forward. So I think the state has done everything they can to acknowledge that there's a lot to put together. Unrestricting things will be a lot harder than restricting it when we went into this pandemic. And the only thing I can say is they acknowledge it and they're trying to work as quickly as they can. Mike Lane?
Mike Lane, you have your hand up?
Yes, I did. So we see in your slide, phase 1, phase 2, phase 3, phase 4. Do we know from the state what triggers phase 2 to start, for example? And or phase 3, at what point after you've had phase 1 can you go to phase 2?
So there hasn't been clarity, but I think it's probably reasonable to expect that after a consecutive 14-day maintenance of these criteria, then you would probably move to the next phase. There was vague in the press conference that the governor talked about shifting to phases, and it was vague in the conference call I was on yesterday about it, but it kind of insinuated that the 14-day incubation period would be, that's consistent, I believe, with some CDC guidance, would maybe trigger a phase 2 opening and a phase 3 and a phase 4. But that is yet to be determined, Mike. So right now, I can't say it affirmatively.
I understand.
I
don't like it. I don't like the way they're putting these carrots out there and continuing to have a stick at us.
Sure. I mean, I think, you know, this is the biggest frustration I think everybody's having is the questions. There's a lot more questions than answers right now. And, you know, like I said, the state acknowledges that they're working as quickly as they can. It just feels like at times, you know, we want it to be quicker because we want to get moving on things. We want to know what the plan is. We want to know what criteria we have to meet so we can get things in motion. But, you know, I would expect by Friday, this is a very different conversation. Every day new information is coming out.
All right. Shauna.
Hi there. I was wondering, can you tell me, is it actually the decision of higher ed and our local school districts if they go back to school, or is this strictly going to be decided on the state level?
So the state has canceled pretty much K through 12 for this year in higher ed. So right now, they're not coming back for the spring. The question about the fall, I think is not, I would imagine that if it's going to be a state decision, I would imagine they're going to approach this from a uniform approach, similar to the way they eventually closed schools. It would only make sense that they would do it from a uniform approach. So my guess is the state is going to either allow it or not allow it. If they allow it and the university decides to do something different, that may be a different question. But I would imagine K through 12 will be top down from the state at least.
Thank you.
Yeah.
Thank you. Martha, you got the last word on this. We got to move on.
Yeah, just so higher, does education mean higher education? It's not clear.
I asked the same question. I don't know.
Okay, thank you.
Yep, good question.
All right. Thank you for that, Jason. More slides?
I think that's it. That's the last of the slides. Yep.
Okay. Do you have more for us for your report?
I have the mid-year review. It's a long one. Do you want to take a break now?
It's a long one. What do y'all want to do? You want to take a break now or wait until 7:30? Not if you want to take a break now. Not up and down or sideways. Yeah, most people are going sideways, so
okay.
No break now.
All right, we're going.
7:30, we're going for it.
Going for it, all right.
That looked funny, by the way.
Let's put this up on the screen.
No, it's getting hot in here. Jason done took his jacket
Taking my
off.
jacket off now. Okay, everybody can see that screen. So I'm going to go through this this presentation. As most of you know, and you saw at the last expanded budget committee meeting, we did a mid-year review instead of a budget retreat, or for the budget retreat, we did a mid-year review versus a next year review, which was probably unprecedented for us. I'll go through this as briefly as I can, but still give some good explanation for any viewers, because not everybody probably got a chance to see the last one, and then I'll go through and answer questions at the end if that works. So this year we did a mid-year review budget, obviously for obvious reasons. It's because of challenges that have come through the COVID-19 response. I will say that, you know, this is the challenge that we have done with it. The challenge with this process is that there's a lot of uncertainty. And generally when I do financial analysis, I have a level of security and confidence. So even if the analysis is not favorable, an understanding of where to go and how this is going to turn out. Unfortunately with this, I have less confidence in it because there's a significant amount of uncertainty with what we're doing and trying to understand where this can go and what the outcome is going to be. And I think that is true across the board with any organization, not only ourselves. So what we're doing is assessing, trying to understand what are the circumstances as we know it today, based on the information we have today. And then what type of actions do we have to take mid-year in order to correct some of the challenges that we're going to face budgetarily. And then this will I think this is going to be a monthly review and update just to understand what's going on, because things are going to change so quickly. So a little bit of context so everybody understands this. New York State Division of Budget put out some forecasts talking about that this COVID-19 response is impacting their tax revenue by about $13 billion. That's billion with a B. 13.3 billion in terms of a tax revenue shortfall. Total impact on the economy, they think it's almost a $500 billion loss in growth, both the loss of growth pre and post COVID actions. In terms of the impact on the GDP, they do think it towers over 9/11 and the 2008 Great Recession, which both had 2% and 10% respective backward movement on our GDP. They do think that this one is going to be in excess of 14% on our GDP. Again, all impacting and relating to the slowdown in the economy. After the fourth quarter, 2020 fourth quarter, they feel that we'll start to have a slow but steady recovery, where you're talking total recovery, pre-COVID total recovery by the first quarter of 2023. So in short, we're looking at a 2.5-year recovery at a minimum. Also something to note, which I think everybody can probably assume by now, is that there is nothing, or there's no area in the state, no area in the nation that is not impacted, or any industry that's not been impacted by this pandemic. So that sets the stage of what the state is dealing with, and we are just a microcosm of the state in this case. So economic and financial indicators, these are slides that I generally go through. It gives good indicators about the economics of what we're dealing with. Our budget is related to the economy. Our second largest revenue source is directly related to purchasing and buying power and consumer confidence. The real estate prices are a direct relationship to income and value of property. So in this case, unemployment is important. As you can see, as of 2019, unemployment was low, very, very low, which was good. That's always a decent indicator. I always preface these slides is that this is not an economics discussion. I'm not going to talk about all indicators, but generally speaking, low unemployment is a positive indicator of a good economy. And generally, we do very well compared to the Southern Tier and to New York State. We're usually always a little bit lower. And as you can see at the end of 2019, we were there. Unfortunately, that doesn't speak to the last 6 weeks or 5 weeks, or pretty much for the past month. So between March 16th and April 19th, unemployment claims went up. And the number of claims, of unemployment claims for us went up almost 3,000% over that 5-week period compared to 2019. Over 2,100% in New York State in general, and over 1,300% in claims in the Southern Tier. Part of this is why we're a little bit higher than the Southern Tiers, because of the density that we have in the area compared to the Southern Tier. Also, the density related to Cornell and some of the larger employers that we have, But in general, as you can see, over a 5-week period, huge decline in unemployment claims filed. Which again doesn't reflect this it's not the same reflection of this, but just a reflection of what's happened over the past 6 to 8 weeks. Inflationary rate, I usually talk about inflationary rate. Generally, if you're around the 2% mark, you're doing all right. We don't have hyperinflation, we don't have deflation, which is good. Consumer confidence. Consumer confidence is another slide that was at an all-time high over the past year, but plummeted just in mid-March. Why? Because of the shutdown that took place. Consumer confidence will play an important part in restarting and opening not only the community, but also the economy. People want to feel confident and comfortable where they're going. They're going to be safe. So that's going to play an important role in this. And it'll really be dependent on the success of communities reopening. The Dow Jones, again, the real financial market, good growth over 11-year period, probably the best 11-year stint in history. And then in mid-March, what happens? We have the largest single-day drop and then the largest single-day gain in market history. What does that say? It says that this pandemic has created some significant instability and inconsistency, which is not what we've seen here in terms of the past 11 years of growth. I also talk about TANF and safety net, TANF being the federal public assistance program with a 5-year maximum on it. As you can see, total assistance is relatively flat over pre-recession, which would be 2008 timeframe, but you can see TANF has continued to decrease, but yet safety net cases continue to increase. So that while the economy was growing and improving, there were some people that were not captured by that growth and the improvement, and they were shifted over to the safety net, which is the state program. Again, TANF is no local cost. Safety net is a 71-29 share. We pay 71%. The state pays 29%. And safety net is a state program, not a federal. But you can see here there's a clear shift of cases from TANF to safety net. SNAP cases, again, food stamps, caseloads generally declining since mid-2014. They're down from a year ago, higher though still from the pre-recession times. But you can see they were on a downward decline up until about a month ago. And that does not give an indicator of what this pandemic has done, but this does. In the month of March alone, compared to 2019, you had 185% jump in SNAP cases filed. You had 98% jump in HEAP cases. That's to do with helping those in need for paying for utility bills. So again, this similar to unemployment. If you look over the past several months, not an indicator, but if you look over the past month, you can definitely see that the pandemic has had a negative impact on our community and our constituents. So now we get into the 2000 mid-year review. That kind of sets the stage, would parallel what the state is projecting in terms of economic hardships that are about to come. So the first thing we've done is we took revenues. We took all of our general fund revenues, about 185 million, and we looked at where can we project revenues moving forward based on the information that we know today. And this changes. Local revenues. Local revenues are revenues that we have some control over, some revenues that we bill for services. But what we did is we had our staff, our department heads who did a great job really in a short period of time trying to estimate what they think will happen based on what we know. And while we are up and running in the clinic, the mental health clinic, with telemedicine, who have done really, I want to give a shout out to them, a remarkable job in a very short period of time of setting up a remote ability to provide services. We do feel that there's going to be a decline in revenue as people begin to adjust to the new setting. We're expecting some decreases in Medicaid insurance payments, as well as preschool education and some clerk fees that have to do around real estate transactions. So we do think that there's going to be some decrease in local revenues. State aid. This changed a little bit from last Tuesday's presentation. What I did is give a mild scenario and then a severe scenario. And the reason I included them in there is we got some new information from NISAC was to suggest that perhaps state aid will take a twist depending on how school state aid is impacted. So if we remember, the governor this year has 3 opportunities to amend the fiscal plan or financial plan mid-year based on any variances. So that first bite at the apple is April 30th. To date, he has not issued any changes to the financial plan, but we are suspecting that something will come by the end of next week, primarily because the comptroller issues a cash flow report mid-month, and generally I think they're going to wait for that cash flow report to come in. Nonetheless, we're expecting changes by the end of next week. The other 2 bites of the apple are the end of June and the end of December. I think state aid is going to play an important role on whether or not we get hit harder or less in the long run. If the governor decides and the assembly and the legislature agrees that they're going to hit school aid less than other municipalities, meaning they're going to take away less aid or not cut as much, I think that will reflect on a more severe scenario for us, from a 30% to possibly even a 50% cut in state aid. So what we did here is we identified our state aid, other than public assistance payments, which is not quote unquote cuttable. We did 2 scenarios, a straight 15% reduction and a 30% reduction. And I think depending on how the governor or the state views school aid will determine whether we are at a mild or a more severe scenario. Unallocated revenue. Unallocated revenue includes the biggest, next to property tax, is our sales tax revenue. So in this case, we had some basic reductions in interest and penalties. We had some reductions in room tax. We think room tax in general across the board is going to reduce 30%, maybe more. Reductions in deed transfer and clerk fees. This has to just do with that we think there's going to be some reduction in, that shouldn't be $1 it should be just 10%, but a reduction in real estate transfers and real estate transactions. Again, increase in refinancing, but yet to be determined with respect to whether or not the real estate market takes a slowdown, which I think it probably will. It's probably safe to say that. And also reduction in casino revenue. So the casino is probably the easiest thing to predict right now because it's closed. And since if it's closed, there aren't going to be any revenue generated. Also, casinos in general pretty much violate every physical distancing and social distancing criteria we've talked about. People are sitting much closer than 6 feet and they're touching all the same surfaces, right? So I don't know what the reopening plan is going to look like, but I'm going to say we're probably not going to get much revenue from it. And then over here, we did a mild scenario on sales tax, which was about a 15% reduction, and a more severe, which is a 20% reduction. And how we determined that is we took the top 15 sectors that make up our sales tax based on data we got from taxation and finance. And we projected out based on last year's sales tax and the percentages, the historical percentages that these sectors have played in making up that sales tax. And we said that this is roughly about what this sector generated last year, which is about 10%, which is restaurants, another 10% out of automobile dealers. So we took historical percentages that these sectors make up of the whole allotment of sales tax, and we plugged it into to split it up amongst the 2019 receipts. And then we said, let's project forward for the next several months. And we projected forward based on any research that we could find on these sectors, moving forward in future months as to how we think the sectors would react over the course of the next 9 months. And in the first scenario, we came up with about a 15% reduction in sales tax, which is this number here. The next one we did, we took a much more severe look at things based on some other data, like a 40% reduction in March, an 80% reduction in April, and then a slow gradual improvement after that. And that's where we have up a more severe scenario of 20%. Now we should be getting our actual April sales tax numbers probably within the next week or two. We'll get with Rick when he has those finalized, and we'll plug it into the model to see what our projections were for April. And we'll see how far or how close we were. Now keep in mind, our April sales tax numbers are actually March sales. So our April numbers will actually reflect a half a month of shutdown for March. It'll be interesting to see how our projections are versus what's actual, and then we'll do the same thing in subsequent months after that. But that's how we created that model. So here we have the mild versus severe scenario. In this case, a mild scenario is about $11 million shortfall in revenue. A more severe scenario is about an $18 million shortfall in revenue. Again, these are the two differences, the two major factors. Now, this was only for the general fund. We have looked preliminarily at the airport fund and solid waste fund, and they too are looking at some revenue shortfalls. But we're going to monitor those as we do the general fund over the course of the next several months to see how they fare. So with that type of revenue shortfall, we knew in March that we were going to start to have some challenges with the shutdown in the community and the economy. So we took some proactive measures early on, which was a hiring freeze and some spending freezes. And then we started to refine that over the course of the last 2 to 3 weeks. So here's a series of actions we've taken to minimize, to really reduce expenses as we start to face a pretty significant revenue shortfall. So in this case, position vacancies to date, we have 32 position vacancies spread across 15 departments, roughly about $2.5 million. Assuming that we fill 4 of these, which are key positions, some point this summer, we think we can save about $2.2 million for the year, leaving these positions vacant. These are vacant positions. Some expenditure reductions range from postponing vehicle replacement, some small equipment, some of the one-time requests, municipal parks and trails grant program, the housing affordability infrastructure program, stream corridor restoration program. You're really just postponing these or not doing them this year, not hiring seasonal workers. Fortunately, because of the low jail population, we've had low board out, so we think we'll save some money there. And then some of these one-time OTRs, the contribution to the LEAD program, the landlord liaison, and the Cornell Cooperative Extension Van, just not doing those this year and revisiting it into next year's budget. In total, we think we can save around $1 million, just shy of $1 million with these changes and these expenditure reductions. And then came agency contracts. We give a lot of money to sponsored agencies. And generally how it works is we give quarterly installments to these agencies. These are agencies that we give general operating money to. And we make quarterly reimbursements to them. What we're suggesting here in this case is cutting the third quarter payments by 25%, just the third quarter. And that would include their target and their one-time budgets because it's one contract. So in this case, a third quarter reduction of 25% would yield about a $500,000 in savings. This does not include target budgets for TC3 or TCAT because these are our budgets and contributions that we have relationships with. In this case, TC3 is with Cortland County, TCAT is with Cornell University and the city of Ithaca. And because we are in partnership collectively, if we were to decrease our contribution, they would have to do the same. So we did not engage in those conversations as of yet. In fourth quarter, very well, fourth quarter payments may need to be reduced as well, but we would propose revisiting that in August and September. I will tell you that all sponsored agencies have been talked to and had some series of questions to them over the past 2 weeks. So this was something that we discussed with them to make them aware that this was something that we were considering, so that they could begin to prepare for this. So that there isn't any sponsored agency that isn't aware of it, but it's about $500,000 worth of savings. And then the capital program. Right now, we were slotted to start design for a downtown facility. Don't think that's a practical assumption right now. So we can withhold a $500,000 contribution from into the capital fund. So we levy a certain amount of money every year, about $6.8 million this year. That's part of our capital contribution. What we're proposing right now is just withholding a $500,000 contribution, which would go towards paying towards the design of the downtown facility. And then obviously this fall, start to reassess the capital plan and make and probably reassess the annual contribution to see how that fits into the budget right now. So this would not be a loss per se of a project, other than we just wouldn't start the downtown facility project this year in terms of redesign. And then unfortunately, after looking at that, furloughs came to be apparent that this was something we had to consider. So the process we went through to discuss furloughs is we engaged with department heads and looked at the amount of work that was being done, workflow that was being done with respect to the shutdown of the offices, the amount of remote work that could be done versus the remote work that couldn't have been done, the amount of individuals that were on emergency leave due to the lack of work. We also looked at this through a lens of as a part of one of the stimulus packages is an enhanced unemployment benefit. It's called the PUA, I believe, the Pandemic Unemployment Assistance. It provides an additional $600 for individuals who are on unemployment. This enhanced benefit really allowed us to look at this through a lens to be able to say, if we can do some temporary furloughs, and furlough and layoff in this case, I'm using interchangeably, they're the same word in this case. We could look at furloughs for a period of time consistent with the length of that enhanced benefit, which means the enhanced unemployment benefit expires at the end of July 31st. So as we looked at these furloughs, we said, how can we do this in a manner in which impacted employees would have minimal, if any, change in their gross weekly income? And unfortunate as the circumstances, I'm happy to say that nearly every single impacted employee and position on this list are going to make the same amount of gross weekly income for the most part. And there are a few that they dip a little bit below it, but it's not a lot of money. It's a very insignificant amount. And that was an important thing for us to look through as we started to do this, to try to minimize the amount of disruption to our employees, as we're still trying to understand the longer term impact of the pandemic. We also worked with department heads to identify a full 12-week furlough, which would be effective basically May 9th, this Saturday through July 31st. That means a full 12-week furlough is 100% furlough. A 12-week part-time or 50% furlough meant these individuals would be working half the percent of the time, still being able to claim unemployment. This is a 6-week furlough. This is folks that would be out for 6 weeks, and a 6-week furlough at 50% of the time, meaning folks who would be reduced time for a 6-week period of time, knowing that some of these folks would have to be brought back or might be brought back depending on a reopening schedule and depending on work demands. Based on this list here, we can identify there's about a $570,000 savings roughly for the general fund, considering the airport and solid waste as well, about almost 590. These 96 positions equal about 12.4% of the workforce, or FTEs, I should say, not the workforce, FTEs, of a 771 FTE workforce. Combined with the vacancies of 32, you have roughly a little over 16%, or about 16% of the workforce or positions are impacted by vacancies and furloughs. And here's a spread of the different departments. This is an example of what a full furlough would mean with certain different salaries. So for example, in this case, I'll take a middle line here, a heavy equipment operator in a highway department making an annual salary of $47,000, almost $47,500, would have a gross weekly earning of $919. Under a weekly unemployment, they would be qualifying for about $460. With the enhanced unemployment benefit, the PUA, the Pandemic Unemployment Assistance of $600, they would be making a little over $1,000. So in this case, if they were furloughed, which we do have HEOs, they would be making gross weekly earnings would be a little bit more than what they would be when they're working. This is another example of a partial furlough where you have an individual of administrative assistant level 1 working 50% of the time. This is their gross weekly income. This is it with the additional enhanced benefit. And here's, I'm sorry, this is 50% with unemployment, and this is the enhanced benefit. So again, compared to their gross weekly earnings, it's more, it's more with respect to, or it's equal or more than what they would be working, than they'd be making if they were working. Again, looking at this to try to minimize displacement to our employees, at least for the time being. Other things that we wanted to consider when we talk about furloughs, which is generally not typical, but we think is important as an employer, is to continue their health insurance for their period of time that they're being furloughed. So the county will continue to pay their share of health insurance, which is 80%. Fringe accruals, the impacted employees will be able to cash in or opt to cash in if they so choose 3 weeks of their available fringe time with transition to assist with any transition until unemployment becomes available. Unemployment benefits have been reported, becoming effective anywhere between 3 to 6 weeks in filing. So providing this option for folks, if they so choose, to cash in their fringe benefits or their accruals, will provide them with some carryover and some assistance during that transition. One thing that they won't have is when they're not working or they're furloughed, they will not earn service credit in the New York State retirement system, but they will have continued access, obviously, to the healthcare as well as the EAP services that we provide to our employees. One thing we wanted to do as part of this was to minimize the transition as best as possible. And I think Anna mentioned earlier, our folks over at the Career Center, unfortunately have been very busy, but have done an exceptional job for the community in terms of being available, being able to call people back. They have, greeting, leave a message, they're calling people back within an hour. So we worked with Jackie and the Career Center to set up 2 webinars, workshops, one on Thursday, one on Friday, for all of our employees to participate in, to understand. They're going to go through how to apply. They're going to show screenshots of the application process. They're going to go through tips that we're going to have, and they're going to help folks to be able to navigate that process. And they'll obviously all be available to answer any questions they have. Again, this is part of trying to minimize the transition for our displaced employees during this time and doing all we can to help them in this transition. Again, some of the services impacted, we will have a reduced paving program this year. So Jeff Smith has done a good job of identifying critical assets that need to be improved while understanding that there are ones that can be put off till next year. Some of the furloughs are possible due to slowdown in work, while others may have to scale up over time. And I'll make that decision along with the EOC, our Public Health Director, Frank Krupa, and the department head to ensure that when we do reopen, the offices are safe. They're safe for the employees. They're safe for the constituents and clients and the customers that they serve. Most of the furloughs are administrative and clerical support just due to workflow being slowed. And some of them are decisions that department heads were able to shift work in order to make it work. One thing that we are also offering is we are offering the opportunity for people to volunteer to be furloughed. This comes into play in 2 different instances. One, in a seniority incident where you have 2 people in the same title, but there's a more senior individual and a less senior individual. Generally, the less senior is the one that would be laid off or furloughed first. In this case, we're providing the opportunity for the more senior individual to voluntarily be considered for furlough for that extended period of time in order to, perhaps for a variety of reasons, personal reasons, they may choose, you know what, I'll take this furlough till July 31st. They are not waiving their seniority rights indefinitely. They're simply saying, for this time and being, I'm waiving them, but I have the right to be reinstated. And believe it or not, a lot of employees have taken this opportunity, more senior employees, to not displace the younger ones, but said, you know what, I'll take this furlough for a period of time because I can, and it meets my personal needs better right now, and not displacing a more junior employee, which is good to see. There's been some cooperation there. The other thing that we've also offered there is that if there's a position that wasn't identified to be furloughed and the employee says, to my circumstances, whether it's for whatever reason, I would like to be considered, the department head and I will talk about whether or not that fits within their work needs. And if so, we'll consider it and make the decision to possibly furlough the individual for the period of time not to exceed July 31st. So there have been people that have taken advantage of this volunteer option, and we're in active discussions with the union, who's also been very cooperative at CSCA, It's 2 units, blue collar and white collar, but they are overarching CSA unit. Before I leave and go off of furloughs, I just want to say that on Thursday we had a discussion with department heads about the process. You know, the department heads spent a lot of time trying to be as creative and working through a lot of these changes, which are very difficult. And come Thursday afternoon, they started to contact all impacted employees. And with the goal that every employee that would be impacted was able to have a conversation and a call from the department head to know that this was going to be discussed publicly on Tuesday, but they were going to be advised ahead of time so that they were aware of it, and to start the open communication with them and help them with the transition. Happy to report that that was successful. All employees were contacted ahead of time and were discussed mostly on Friday and on the Saturday, so that they were aware that this was going to be discussed and action was going to be taken. So, you know, again, this feeds into our perspective of ensuring that the transition is as least disruptive as possible as we can for our staff as we look out for them. Other budget considerations, I'll move off of that. There are some that we know that are going to be impacting our budget based on the recent state budget. We're going to get hit with the full cost of 730 restoration services. 730 restoration services has to do with the criminal procedure law 730, in which an individual who's arrested is not deemed fit to stand trial, so therefore has to be hospitalized. In the past, the counties have shared this cost 50-50 with the state. The state has determined through its recent budget process that we should cover the whole cost of it. So for us, it'll be an additional $350,000 a year. And the state also has decided to take $331,000 of sales tax from us to support a distressed hospital and nursing home fund. Potential retirement costs, just got off a conference call today with NISAC. It's a little early to tell, but I would expect a 7 to 10% increase in retirement costs next year as a result of the drop in the market, but we'll wait and see. EF-MAP funding has been the question of the past 3 or 4 weeks. Got some increased aid through the stimulus package. It is being discussed and determined. I've been in touch with NISAC. I know Martha's been in touch with NISAC a lot over this issue, ranging between 590 and 2.3 million. We don't know about it yet. It's there. It should be ours. How it's going to be distributed, we don't know. My guess is it'll be distributed in reduction of our weekly Medicaid bills, but that's yet to be determined, hopefully sooner than later. Reconciliation is something. So EF-MAP aid that came through the Affordable Care Act. We were supposed to get additional reimbursement through Medicaid from the federal government. And for the past 3 years, the state has not reconciled this EF-MAP aid. So we're due 3 years of reconciliation. If I had to take a guess, I would say that the governor would release this reconciliation aid at the same time he cuts aid from us, to say that it is a net zero impact to us, if I had to take a guess. That's just my guess. That's a prediction. We'll find out in a week and a half. We don't know when that's going to come. It's delayed. We'll see what happens. We did get I forgot to change this, $257,000 of increased aid through COFA to the state budget, yet to be determined if it's unrestricted and if the governor will take it back through a series of cuts. So in this case, these are some unknowns. I've banked on these two, the increase in the 730 restoration and the decrease in sales tax, because that's what I know to be true right now. The other ones are pending. All in all, here is a rough scenario of the mild and severe options. In this case, a mild revenue shortfall with some expenditure reduction still gives us an operating deficit of over 7 million, and in a more severe scenario, an operating deficit of over 13.5 million. Not a great picture. Again, we'll refine this monthly. Revenue shortfall between 11 and 18 million dollars. If we were to make that up in a tax levy increase, it would be between 23 and 35% of a tax increase, well above our tax cap. So our next steps, a little bit above a tax cap, even with the Dryden factor from last year, well above the tax cap. Next steps, maintain the current vacant positions throughout the year, make the plant reductions, reduce the third quarter payments to supporting agencies, amend the capital plan, and move forward with the furloughs. Next steps, we're going to be looking at a potential retirement incentive that will present to the legislature if it makes sense, that may encourage individuals to take an early retirement with the expectation of probably not filling some of those positions. I will also take a look at our current and retire health insurance to see if there are any potential savings with changes to those plans. Future planning, monitor the state actions again. I expect by May 15th, we will have a proposal from the governor as to what changes he's proposing in terms of cuts, and develop a reopening strategy with our facilities. Again, I mentioned just today, the planning team and EOC issued some guidance to departments to start to plan on what those reopening strategies will look like. And over the course of the next 2 to 3 weeks, we will start to work with department heads on strategies anywhere from physical distancing in the workplace for employees to customers, to face coverings, to signage, to anything you can think about on how we can ensure that when we're ready to reopen, our staff are protected and our customers are protected, which is important. And then begin to work with county departments on most likely what I will expect, or probably suspect at this point, will be some structural budget changes going into next year. This does not include any federal aid. Federal aid would be great. I know it's active discussions. I know Martha will talk about it a little bit, but right now, our New York delegation has been very coordinated, bipartisan coordination in submitting some bills around federal aid. Would love that to happen. This doesn't assume that. Even if it does, I still think next year's budget is going to be structurally challenging depending on how the recovery goes. So just a few words as we end. Uncertainty is a common term that we're using right now because it explains what the future is. Obviously, there's been short-term impacts as a result of the economy slowdown or shutdown. It deteriorated very rapidly. And in some places, it exceeded what to expect. The timing of the restart, which is slotted for the third quarter of 2020, at least that's what the state's saying, is questionable as to when it would come into place. Then it also is partnered with the monitoring of positive cases and disease management. The pace of the restart is going to be an important part of it. How quickly do we restart? How quickly do people resume activities? What type of spending power and income do people have available to them to continue to resume their activities as they were pre-COVID, so to speak? And then concerns about uncertainty again. We've been reading about, I'm sure everyone has in the news, about states that have rushed to reopening. Is that going to create a second wave of pandemics? The fall is likely to have, as we do with normal flu season, is that going to spike cases again? How do we manage that? That again feeds into confidence of the public, which ultimately feeds into a lot of things in terms of reopening the economy. So all of these feed into uncertainty. Nonetheless, we have to work together through our partners, whether it's through other municipalities, whether it's with our constituencies, whether it's with our other agencies we work with, our other levels of government. There will be opportunities that will come at this at some point, and that our leadership and perseverance will be critical. Our community is looking to us as a leader, as a county government and a leader, and I think we've been living up to that. We'll continue to do that to support and provide the confidence to our constituents that we'll be able to make the right decisions moving forward. So that's the summary of the mid-year review. I went a little fast, I apologize.
No,
but
that's all right.
let me
We've
put up.
seen some of this before, so thank you.
Let me put this up and I'll.
So can we take a break before questions, folks? Can we just why don't we just take a break to digest some of this information and be back here in about 10 minutes to get your questions together. Okay, so we'll take a break right now at 7:44. Thank you all, and Rich, I see you. You have first dibs when we come back.
Okay, we're off mute now.
Okay, thanks.
We're off mute.
Leslie, there was a reason why they didn't include race and ethnicity, and it had something to do with the way the data was collected and shown. So I asked them to give me an answer to why. There's a specific reason why they didn't show it that way. I didn't understand it.
It's just a title.
Jason, you're not on mute.
Okay.
We're going.
All right. Is everybody back? How many legislators do I have back? That we have, folks? Can I see you so I know you're back, that we can? I have 8 people back yet. Yes, we do. Thank you very much. All right. We will resume our legislation meeting after the break. Thank you very much. Rich, you had your hand up first, followed by Shauna. Questions for Jason on the mid-year budget presentation.
Thank you, Leslie. And Jason, thank you for all your work on this. This is really, really painful, but important. And I understand how hard this must have been for you to go through this. I appreciate the detail and the effort from you and your staff. I did have one particular question on the 730 numbers. Is that a budget number that New York State will withhold, or is it based on actual people that go into the state mental health hospitals?
So the number is based on actual expenses. So our actual expenses over the past years is a reflection of 50% of the cost. So it's a pretty straightforward estimate. And what we did is we looked at the past several years of trending, and they were around the $300,000 to $350,000 mark when we were paying 50%. So in that sense, it was really just a doubling of the number.
If I could follow up, if we have far fewer people going through our criminal justice system and perhaps needing these services, is it potentially possible we wouldn't take that big a hit?
Yes, it's possible. One of the challenges we've had is over the past several years, we've been slowly increasing the amount, although we've been drastically under budget. So this is a spike up to kind of, it's probably a $200,000 or $150,000 jump from where we are budget-wise now. And I would say, we probably need to get another year under our belt to determine if that can come down. But technically, you're right, if there's less people jailed. However, these are not individuals that are jailed. These are individuals that are not fit for trial, so they have to be hospitalized. It's possible with our wellness court that these a case or two may be able to go through it, but these are generally pretty severe cases. So I think time will tell, but either way, I think it's going to be at least a few $100,000 hit for us for the next year.
Thank you.
Shauna?
Jason, thank you very much for working on this, both you and your staff. I know that with each decision that was made, it took a lot of time, and you really tried to look at the situation at hand. I also want to convey to our staff that we also take this very seriously, and that we definitely realize that these furloughs affect you and affect your livelihood and your families. We are going to have some very difficult times ahead of us with some very difficult decisions. But we are certainly concerned about this and thinking of you and your families. I have 2 questions. Is furloughing a short-term solution, or do you foresee these being extended? And then my second question is, what needs to happen for all 96 of our furloughed employees to come back to work?
So the first question is the intent of this initial furlough is to be temporary. It's intended to last as long as July 31st, with the understanding that mid-June and the end of June and beginning of July, we'll start to look at the circumstances to see if they've changed. I did communicate with the whole workforce Monday afternoon through a live town hall discussion. This question came up, and I explained that the intent is for it to be temporary. However, if staffing reductions have to take a longer period of time, or a possible permanent circumstance, that is a possibility. It's just
too hard to know right at this point in time. So these are intended to be temporary, but they could be longer in terms of staffing reductions. I should say as part of that, that if there were to be more permanent staffing reductions, the individuals that are furloughed may not be the individuals that are impacted through a permanent reduction because of seniority, bumping rights, civil service law, and some of this voluntary furloughing that's take place. Remember, those individuals have not permanently forfeited their rights, but have temporarily done so. So there could be different individuals impacted. To answer your other question about what would we have to do to bring people back, I have the ability to bring individuals back, and we'll do so based on certain workload needs and circumstances, but we'll be reviewing that very closely depending on those circumstances. If you're talking structurally, budget-wise, what would need to happen, I think we need to have a more structurally sound budget with respect to confidence in what our revenues are going to be, closer to what we budgeted versus what we're talking about now.
Thank you.
Thank you, Shauna. Martha, followed by Anna.
Thank you. I want to echo everything that Shauna and Leslin have said and you've said, and especially mention Lisa Holmes, who I know has been doing this work side by side with you and working out an amazing number of details and really treating people with enormous respect. So thanks to Lisa. Jason, I thought when you said that you thought that the governor would release reconciliation on Medicaid funding, that you would finish that sentence with "when pigs fly." So I guess it'll get, yeah. Everybody should certainly, anybody who's listening to this should certainly understand that all of this is a moving target. When you've got a range of overall gap being from 7 million to 13.5. These are good projections. These are good estimates, but it's everything can change. Could you off the top of your head tell us what on the capital program? I think you said that you were proposing to delay $500,000, $500,000, was it?
Yes.
It was planned for of the downtown office facility. What is our contribution to capital on an annual basis?
I believe our contribution this year is 6.8 million. So a big majority of that is debt service. I did talk to Rick before we finalized those numbers to make sure that I was looking at them correctly. And to say, if we were to withhold a $500,000 payment to the capital fund to support the capital program, we would still be okay. And he confirmed, yes, we could do that. So we contribute about 6.8 million. Remember, this year we increased the contribution from 0.5% to 1%, which was a great contribution as we looked at a really aggressive and robust capital plan. Nothing says we can't do that, but we're going to have to prioritize it now depending on how things fall out in the course of the next several months.
So that 1% is what?
I'd have to look. The increase over the prior year, I thought, was around $500,000.
Okay.
And again, I'm not suggesting a target change right now. I'm suggesting just we withhold that payment this year as we postpone a project. And then we'll figure out what the target should be as we go through next year's budget preparation.
Okay. Thanks very much.
Thank you, Martha. Anna, then Mike Lane.
You're on mute, Anna.
Yep, I see. Thank you for this work. And I know I won't repeat anybody else's sentiments. I'll just acknowledge that I think we all are feeling very similarly, and thank you all for expressing it. I know that you worked really hard to minimize the impact as much as possible. So that's very important. You mentioned, and I know somewhat jokingly, the amount of the debt that we need to close, the gap that we need to close or will need to close. And certainly it can't all be put on property tax, whether there's a cap or not. Can you talk about some of the other possibilities, including, what we have in reserve, and if taking from that reserve, what that would do to our bond rating, other considerations that could be on the plate for closing that gap?
Sure.
It's a good question, and one that, like was mentioned earlier, is a moving target. So what we would, as we go through this process, we'll see how the economy responds, primarily how sales tax responds. We'll see what type of hand we're dealt by the state in terms of permanent reductions in state aid. And then at some point, as we get closer towards the fall and into the late summer, as we begin to put the budget together, we're going to have to look at what type of level of confidence do we have for revenue growth in the following year. It's kind of going through the same process as we just went through to develop this mid-year review, but kind of looking at it with a forward eye. And we're going to have to look at some service requirements and what service levels we want to continue to maintain. Depending on what type of market stability we think or what type of signs where we're indicating in terms of recovery, that may inform us to saying, you know what, we can stomach using some fund balance over the next year or two to weather a storm until revenue levels improve. That's a risk. It's going to have to be a calculated risk, and it's a risk that I know Rick and I would take would not take lightly. So it has to be balanced. What you can't do is balance a budget using an enormous amount of fund balance, hoping that the economy is going to improve, because what will end up happening is you end up blowing a lot of fund balance in a short period of time and then just delay the inevitable. So there's a calculated risk that has to be understood. And the factors playing into that are going to be the confidence that we have in the market, the confidence we have in revenues, confidence we have in state aid, and what type of level of service we want to provide in different areas. And that's going to balance, what type of tax levy you're going to want to consider, as well as what type of fund balance we may want to consider. So it kind of throws everything up in the air, but we have to strategically look at the first thing we would do is understand the knowns that we have. We know that we think this revenue is going to be confident in this range because of these reasons. And then you start to work backwards from there to your least confident ones. And then at the end of the day, you see how far that gap is to determine, all right, how are we going to close that revenue and expense gap? Do we use some fund balance? Do we increase the tax levy? Do we reduce expenses? Those types of things. So that's a question and an answer that will change month by month as we go through this.
Thank you.
Thank you. Mike Lane, followed by Henry.
Jason, I like what you just said. I think it's true. And I join with all the rest of the folks that spoke ahead of me here, saying there's no joy in what we're having to do with respect to our employees. As legislators, we want to do good for the most people that we can, and it hurts us when we share and have to inflict unhappiness on our own employees. But I think we need to think a little bit further. This is not the end of the world as we know it. Let's remember that this recession that we're into now was self-induced. And the reason it was self-induced was to protect people from dying and to stop not having our medical system overwhelmed by this COVID catastrophe. We didn't have to, the state didn't have to say, close down, stop all the businesses. They could have just said, well, it's too bad, we'll lose a few people, but we're going to keep the economy going. But that's not the right thing to do, and it's not what we did. But the fundamentals of our economy are strong. They will continue to be strong. It'll take a while to revive them, no question about it. But this is not the end of the world as we've known it. And we have to go slowly. We have to take steps that we don't want to have to take, but we'll get back. We are part of an America that is strongly devoted to education. We are in the midst of an education economy here that is the envy of the world, that produces people and educates people around the world. We are not as strong in manufacturing as we might like to be, but we still are producing goods and services here, and we will continue to do that. It'll take a while, but I think we need to think that be somewhat optimistic, because
this thing has happened in 12 weeks. It won't restore us in 12 weeks, but we'll get there. Thank you.
Thank you for that optimism, Mike. Yeah, it's good to look to what positives can come out of every crisis. There's opportunity. That's how I look at things sometimes. So thank you for that. Spoken like a true statesman. Henry.
Jason, in terms of your severe analysis, is that based on, like, for the sales tax revenue, is that based on NISAC's information, or is that based on like something like Cornell not opening in the fall semester?
It's based on the different sectors and putting in different sales decreases compared to 2019 sales.
Mm-hmm.
So a lot of it is structured around what some of NISAC is seeing. So they're going to come out with a publication the next day or two, which is also going to have a mild and severe scenario, and we're within range of what that mild and severe scenarios are. So, we have some different information triangulated. At this stage of the game, Henry, it's probably worth doing a mild and severe scenario and seeing what happens with April's numbers, and then seeing where we were off and why we think we were off there, and then triangulating that information, and then once you get to May's numbers, doing the same thing, and you'll start to see some trending at that point. If the actuals are well off the mild and closer to severe, then that's probably what we'll start to gravitate towards. So it's, to a certain extent, it's a little bit of a shot in the dark, but I mean, we're taking the information we have available and trying to project what the industry or the sector is going to do for the rest of the year. Yeah, it's hard.
Okay, thanks.
All right. Thank you very much, Jason.
Thank you.
Thank you, legislators.
Oh, there's a resolution that has to be introduced.
Yeah.
If I could just add, I know I've mentioned this before, but there's some key people part of this process. Obviously, Lisa Holmes played an important role. She's still pulling double duty as our interim director of human resources, and since August, she's done a phenomenal job. Still also being our deputy county administrator, has done a great job. From a specificity perspective, working with department heads, trying to navigate the process, having difficult conversations, and pressing forward. She was a great contributor to this and has done great in terms of assisting with the rollout, as well as the HR staff, to try to make this transition as seamless as possible. I just want to give a shout out to her, as well as Kevin McGuire. As you know, Kevin and I are generally attached to the hip from mid-April to the end of the year. That has not changed, although it's virtual. And he has been a great help trying to crunch the numbers, as well as the department heads. We asked a lot of different questions this year from department heads about revenue projections, of which they had difficult time answering, expense reductions, different conversations they've had with employees. So really a good effort from a leadership perspective of the organization to try to get our arms around this the best we can in order to make the right decision. So I think they deserve a good hats off and credit for the hard work that they've done. That's all I have.
Thank you for that. Rick, Andrew, Jonathan, do you have anything to add that you wanted to really tell us tonight?
No report.
Thank you, Jonathan. Rick, do you have anything that you absolutely needed to tell us tonight?
I do have one short thing.
No, that's all right. You're a finance guy. We love hearing from you.
I like to bring that one glimmer of light and hope that sets us sitting a little bit pretty. But I thought I would give you our first quarter casino revenue report. And because it was open, in the first quarter, it did quite well. We earned $439,644 in the first quarter for both casinos added together. That compares to last year when we had $489,000. So it was a good quarter. It was down 10.1% for the first quarter. Of course, we know it's closed for the second quarter and we don't know how long, but I did project if it was closed for the whole second quarter and also closed for the whole third quarter, and then we had a halfway decent fourth quarter or an average fourth quarter, Our receipts for the year would be $879,300, which would mean we fall short of our budget by about, for that line item, by $630,000. So that's a little bit, I think that's pretty close to what Jason was talking about earlier in the loss of casino revenues. I think he was saying we would lose maybe $1 million, but somewhere between those figures there is what we could expect to lose. But again, a successful first quarter, no idea what's going to happen in the next 2 quarters.
Rick, at the beginning of that, I literally was going to, go back to my British days and knight you, take away the title from him, Mr. Sunshine, with the 400 and something. And then you just totally obliterated that. So no knighting of you as Mr. Sunshine. Martha.
I'll try harder.
But thank you for the honesty and sharing what's really going on. Okay. Martha?
Yeah, so the first quarter includes a couple of weeks when the casinos were shut down, right?
That's true. Yeah.
Okay.
So that 10% dip was probably a result of the partial month of March being closed.
Okay. Thank you.
You're welcome.
And I will sing Mike Lane's praises here for a minute, because he always say, don't rely on that casino revenue. Never know what's going to happen with it. So Mike, there you go, coming true. All right. Were there any other county staff who needed to share anything else with us who's on the line? Amy or Lisa or? No. All right. Our resolution is to be added or withdrawn from the agenda. Anna?
Yeah, there's one agenda item that actually it was a mistake that it wasn't on an oversight, that it wasn't on this agenda. It came out of committee of HED unanimously.
What's the resolution, babe? I think you're frozen or something. I can't hear you anymore.
Yeah, my computer froze for a second.
Okay.
But the title is Resolution Urging the State to Establish an Emergency Rental Assistance Program, S8140 or A10248, in response to the COVID-19 crisis.
And that's resolution F?
Correct.
9328. Okay. So you're moving to add that to the agenda. Gonna have someone second to move it to the agenda, and then we need to, seconded by Martha. All right. Any discussion about adding it to the agenda? No, let's move. We need 10 votes and it's roll call.
Shauna Black,
Yes.
Amanda Champion,
Yes.
Deborah Dawson,
Yes.
Henry Grandison,
Yes.
Rich John,
Yes.
Anna Kellis,
Yes.
Dan Klein,
Yes.
Ann Corman,
Yes.
Mike Lane,
Yes.
Dave McKenna,
Yes.
Glenn Maury,
Get your space bar.
he's shaking his head yes.
That's a yes from Glenn Maury.
Martha Robertson. She's on mute too.
Yes.
Yes. Mike Sigler,
Yes.
Leslyn McBean Claiborne.
Yes.
14 ayes, 0 no's.
All right, that's added. Thank you very much. Anything else to be added or withdrawn? Martha, you're waving, yes?
Yes. County emailed today, a resolution should be in every inboxes. It's called, titles authorize and direct the county administrator to carry out furloughs for certain identified county employees during the COVID-19 pandemic. And I move that.
Martha, thank you. Can I have a second to add that to the agenda? Seconded by Mike Lane. Roll call, all in favor of adding to the agenda. Roll call.
Shauna Black,
Yes.
Amanda Champion,
Yes.
Deborah Dawson,
Yes.
Henry Grandison,
Yes.
Rich John,
Yes.
Anna Kellis,
Yes.
Dan Klein,
Yes.
Ann Corman,
Yes.
Mike Lane,
Yes.
Dave McKenna,
Yes.
Glenn Murray,
Yes.
Martha Robertson,
Yes.
Mike Sigler,
Yes.
Lesley McBean Claiborne.
Yes.
14 ayes, 0 noes.
All right, that's added to the agenda under budget, I believe. So let's move on to the rest of the agenda. I don't think there are any consent agenda
Just
items.
appointments, just appointments.
Oh, just the appointments. Two, under consent agenda, we have appointments to the Personal Emergency Response Service Advisory Board. Dan Klein, we know that guy. Term to expire December 31st of 21. And to the Recreation Partnership Board, Henry Granison, we know him too. Term to expire December 31 of,
Yeah, it should be,
can't be correct, this is
it should
29.
be 2020 or 2021, I believe.
20 or 21.
I'll check on that.
Well, double check on that, Henry, but you're appointed.
Okay.
And Dan, so are you. Do I need to vote on the consent? We need to vote on the consent agenda. Roll call vote. Do somebody move it? Somebody has to move the consent agenda. Amanda does, seconded by Ann Corman. Roll call vote.
Shauna Black,
Yes.
Amanda Champion,
Yes.
Deborah Dawson,
Yes.
Henry Grandison,
Yes.
Rich John,
Yes.
Anna Kellis,
Yes.
Dan Klein,
Yes.
Ann Corman,
Yes.
Mike Lane,
Yes.
Dave McKenna,
Yes.
Glenn Moran,
Yes.
Martha Robertson,
Yes.
Mike Sigler,
Yes.
Lesley McBean Claiborne.
Yes.
14 ayes, 0 noes.
Okay, consent agenda passes unanimously. Thank you, gentlemen, you're appointed. Moving on to our standing committee and special committee reports. Again, I encourage you to make it crisp. Health and Human Services Committee, Shauna Black.
Thank you very much. We have not met since our last legislature meeting. Our next meeting is Monday, May 18th at 1 p.m.
Thank you for the crispiness of that.
Thank you.
Any questions for Shauna? No. Facilities and Infrastructure Committee, Mike Lane. Sure.
Thank you. We have not met since our last legislature meeting, but as promised, we have some resolutions about the airport that have come to this meeting. I'll just mention that our next meeting will be on May 21st at 9 o'clock. Unless there are any questions, I want to proceed to the resolutions.
All right, and I do believe Mike Hall might also be on the line, is he?
I think so.
Okay. All right, go ahead.
Resolution A, which is a seeker resolution, relating to a capital improvement project at the Ithaca Tompkins Regional Airport. That's ID 9254, and I so move.
Second. Deborah? Discussion? All right, roll call vote.
Shauna Black,
Yes.
Oh, sorry, Jonathan, did you want to say something?
No, I coughed.
Oh, you lit up, so I wasn't sure. Sorry.
Amanda Champion,
Yes.
Deborah Dawson,
Yes.
Henry Grandison,
Yes.
Rich John,
Yes.
Anna Kellis,
Yes.
Dan Klein,
Yes.
Ann Corman,
Yes.
Mike Lane,
Yes.
Dave McKenna,
Yes.
Glenn Moran,
Yes.
Martha Robertson,
Yes.
Mike Sigler,
Yes.
Lesley McBean Claiborne.
Yes,
14 ayes, 0 noes.
thank you. Passes unanimously. Go ahead, Mike.
Resolution B, which is a resolution of the Tompkins County Legislature as the elected legislative body of the Tompkins County, New York, in accordance with Section 147F of the Internal Revenue Code of 1986 as amended, approving the issuance by the County of Tompkins, New York, of its Airport Bond Anticipation Notes 2020 Series C, subject to the alternative minimum tax in an aggregate principal amount up to $3 million. That's ID 9257, and I so move.
May I have a second? Dave McKenna. Discussion. Martha Robertson.
Hi, Mike. Paul, how are you? Mike Lane, would you just kind of give a few words about what we're doing here? I'm sure that if anybody's watching on YouTube or wherever.
Okay.
Explained it.
Asking
Thank you.
for a little more detail on what it's about.
Well, this has to do with a possible $3 million bond issue by the county, which, in order for it to be properly tax deductible and to be available to potential buyers of the bond so that it will be tax-free as a municipal bond, this resolution is required by the IRS to comply with their regulations to show that it is a municipal bond that is allowed to be tax exempt. Rick, did I get that right?
That's absolutely correct. This is what we call the TEFRA resolution, which is an extra resolution we have to do for airport bonds specifically. And it's because of that special part 147F of the Internal Revenue Code that we have to meet as a legislature, have that public hearing, which you had earlier this evening, and then go ahead and ordain that this is a tax exempt offering. And that's what the purpose of this particular resolution is. It's not the same as a bond authorization resolution, although it looks like it. That will come later tonight, but this is that extra TEFRA resolution that's to support the improvements at the airport.
Thank you, Ed. Thanks, Martha, for asking that. Thank you, Mike. Any other questions on this? All right, roll call vote.
Shauna Black,
Yes.
Amanda Champion,
Yes.
Deborah Dawson,
Yes.
Henry Grandison,
Yes.
Rich John,
Yes.
Anna Kellis,
Yes.
Dan Klein,
Yes.
Ann Corman,
Yes.
Mike Lane,
Yes.
Dave McKenna,
Yes.
Glenn Moore,
Yes.
Martha Robertson,
Yes.
Mike Sigler,
Yes.
Leslie McBean Claiborne.
Yes.
14 ayes, 0 noes.
Thank you. Passes unanimously. Go ahead, Mike.
Now we're down to Resolution C, amending bond resolution of the County of Tompkins, New York, relating to a capital improvement project at the Ithaca Tompkins Regional Airport. That's ID 9255, and I so move.
Second. By Glenn Morey. Discussion. Sorry.
We have one that was distributed with a proposed amendment on it.
Yes.
It was included with the.
There's an amended version, a revised version.
That's what I was moving.
That's what you are moving. All right. The revised version. Thank you very much. And Glenn, you're seconding the revised version.
You're correct.
Discussion. Deborah Dawson.
Thank you. I understand on the advice of F&I and as part of this ongoing airport project that we committed ourselves to these many years ago, that this was kind of foreordained. I will say it pains me to vote for it on the same night that we voted to furlough employees. And were this not a supremely inopportune time to piss off the governor, I would be voting for this. I will vote for it, but I just want to say that I'm not willing to, under the current circumstances, give any more money to the airport or basically any other major capital project in the county until we get our county back on its feet. Thank you.
Thank you, Deborah.
An answer.
Shauna.
Thank you. I am not going to be supporting this resolution or Resolution D tonight. I do not feel like they help our constituents, and right now is really the time that I don't think we should be moving forward with these projects. So I will not be voting for this. Thank you.
Thank you, Shauna. Ann Corman.
Thank you, Madam Chair. I will be supporting this and the next resolution. I think just as we are supporting other transportation, TCAT, as we see how vital that the colleges are to our area, as manufacturing, the little that we do, but the tech industry and tourist industry are vital to this community. I see that this is part of that. This is part of the transportation that we need. And if I would like to put Mike Hall on the spot a little bit to, because he has talked to us about how he has been able to shave off some of the project expenses so far, and as far as he's able to talk about that. And the fuel farm I'll talk about later.
Thank you, Ann. Martha, and then I'll hear from Mike.
Okay, all right. You'll hear from Mike Hall afterwards, you mean?
Mike Hall, or I can take Mike now. But you think he'll answer your question? Why don't you ask your question?
No, I'm happy to wait for Mike.
Okay.
Okay, am I on to answer Ann's question?
Mike Hall?
Yes.
That would be
Yes.
great,
Board
Mike.
Manager? Go ahead, Mike.
Yeah, we have said for the last couple of years that we would borrow not more than $10 million for the county share of the Broad Airport project. And that now includes the fuel farm, which was a related piece. And I stand by that commitment. Now the path to financing all this, I can't get into. That's up to Jason and Rick. But we will not be borrowing beyond $10 million.
Okay.
All right.
Annie, does that answer your question?
Kind of, but I'll just suffice to say, and maybe those were private conversations, but behind the scenes, but I know that Mike Hall has done everything that he can to look at the fiscal responsibility for the airport. And again, I think the airport is going to be part of our revitalization and reopening up. That's going to be intricate to our economy. So thank you.
Thanks, Annie. Martha Robertson.
Yeah, thank you. I'm going to support this too. I know the time, I know the timing is terrible. The kind of decision that Mike Lane talked about earlier, about the fact that we know we will get past this. This is, the world will find a cure, we'll find a vaccine. We will be able to come out. And these are the kinds of projects that take years to develop. So I think we have to really make sure we are, we always want to make sure that whatever the decisions we make are the right ones. And this was the right one when we got started on this project, and it remains the right decision. I want to point out that the DOT facility, moving the DOT from the waterfront, moving it next to the airport, basically was, and when Deborah talked about pissing off the governor, this was part of that project, was that we would create a new fuel farm that the DOT trucks could use if they moved up next to the airport. So this is really part of a longer term vision. It also will allow other municipalities, other users to use the facility. It comes outside of the security fence of the airport. Is that right, Mike? So
Which Mike?
Mike Hall.
Yeah, that's correct. We will be able to save municipalities significantly on fuel costs as a result of them using this refueling point as opposed to getting fuel in other places.
So I think it's still a good project, a worthy project, something that is on balance the right thing to do. And by the way, this doesn't mean we have to borrow the full amount here. This just gives us the authority. It gives Rick the authority to go get the best deal he can, which he always does. And Mike Hall has already been able to secure, was it 1.7 million of new money from the FAA? Or
there's a 1.77, it's 1.8 million in the CARES Act that will be coming to the airport. It can be used for debt relief or operations. And, we want to move with caution here because we're not really sure what lies 3 months out, 6 months out. But certainly it's our intention that we'll be using that for debt relief. And that will be because operations at the airport, along with the rest of our economy, have recovered sufficiently to allow us to continue to be an enterprise unit that does not rely on general fund support.
And the fuel farm itself was got $1.5 million from the state, was a year ago or whatever. So
correct.
There's a lot of other money in there already, and we can hope that as things move along, there will be other targeted money from the feds that would not be able to go to county operations, but may likely be able to help with the airport. So I'm okay with supporting this at this time.
Thank you, Martha. Amanda Champion, Rich John.
Yeah, great. Thank you. I appreciate the work that has gone into this, and as most things that come before us, people much smarter than any of us have been thinking about it. But I don't think I can support this either. I'm having a bit of deja vu from about 2 months ago when we sat here and said, oh, it's not the right time to talk about a conference center. People are getting sick, people are dying. Well, this is a pretty harsh situation we're in. And, what made sense 2 months ago or a year ago doesn't make sense anymore to me. So I'm sure it'll pass. I think this will end up happening, but if we're saying it's not the right time, it's not the right time. So I won't be supporting this tonight. Thank you.
Thank you, Amanda. Rich John.
Thank you, Leslie. I will be supporting the motion. I think it's important even now in this difficult time that we honor our commitments, and we've certainly made commitments in regard to this project and others. We also, I believe, should make sure that we are playing the long game, even when it's a hard decision. In the long term, this will be good for all the municipalities that can benefit from this. And it's a worthy improvement to the overall airport. So I will support. Thank you.
Thank you, Rich. Anna Kellis.
Yeah, Rich, thank you for that. That was part of what I wanted to say, was that as painful and difficult as it is, as the governing body, we're asked to think both short-term and long-term, and the economic recovery process is going to be difficult. And I think that part of the discerning process is to invest in things even now that will help us create that economic recovery. So I very much respect where my legislative colleagues are on this, and that it is really difficult. So for those people who are voting no, I actually really understand it and respect it. But I will be voting in support of it, looking long term. And Mike, I know that this has been your blood, sweat, and tears for years. And I've watched you work with tremendous humility and with the eye of the community, as your central focus, and how to benefit the community and how to create a community that's very inclusive. As your messaging has always been, it's about community inclusion. So thank you so much for that. And I wanted to ask you, and maybe this is a question for Jason as well. I would say one last thing. I also appreciate your focus on safety. I know that there has been a lot of questions and concerns about safety with respect to immigration, for example, and I know you continue to talk to people in the community. That's really important to me. And I appreciate that you're continuing those conversations and that you're always keeping that in mind. So with all of that in mind, I do support the work that you're doing. Jason and Mike, the 10 million that you talk about for bonding, that's not, I don't want people to think that that's all going directly onto property tax. There are multiple, pots of funding that this could go to. Could it all potentially be from airport fees? I know in the current situation that we're in, that might be different. But that was the original intention, was to focus it on airport fees and not property tax. So could you speak a little bit to that?
So when we decided what the county contribution to this overall project could be, and that's the nominal $10 million, that was the upper limit that we could reasonably expect to carry debt with passenger facility charges. And each person going through the terminal contributes right now approximately $4. We expect in the future that's going to go up significantly. This is another question to which there's no definitive answer right now, but if we recover expected traffic levels or increase, we were headed for a 20% increase this year before March. So as Mike Lane said, fundamentally we have a strong nation and economy, and if we're able to recover those levels, it is certainly still possible that this entire project will pass with no support from the general fund, so to speak.
Thank you.
you. All right, I'm trying to wrap this so we can get to a vote. I have Mike Lane and Ann Corman.
I just wanted to remind folks that this is an intermunicipal project, and this is our contribution to it. I was there years ago when we were trying to get the DOT facility off the inlet. And at that time, we were actually talking about the county building the residency and trying to come up with, I think at that time it was $15 million that it was going to cost in order to free up that prime property on the inlet. We're getting that to happen now due to the state building the new residency at the airport at no cost to us. Except we sold them a bit of the airport property, and we've agreed to do this joint project about the fuel farm. So we get a benefit from the fuel farm, and as Martha spoke so well, other municipalities get to use it as well as us and as well as the state DOT. I think it's win-win. Nobody likes to have to spend money or go into debt. But this is an economic development, not only for the airport and Tompkins County as a whole, but for the city of Ithaca.
Thank you, Mike. Annie, did you want to say something, or you just didn't take your hand? Okay. All right, we're going to take this to a vote. We need 10 votes. This is a bond resolution, 10 votes for it to pass. Roll call.
Shauna Black,
No.
Amanda Champion,
No.
Deborah Dawson,
Yes.
Henry Grandison,
No.
Rich John,
Yes.
Anna Kellis,
Yes.
Dan Klein,
Yes.
Ann Corman,
Yes.
Mike Lane,
Mike, we can't hear you.
Mike Lane,
Sorry, yes.
Dave McKenna,
Yes.
Glenn Maury,
Yes.
Martha Robertson,
Yes.
Mike Sigler,
Yes.
Leslyn McBean Claiborne,
Yes.
11 ayes, 3 noes.
That passes. Thank you very much. Thank you, Mike, for information as well.
I'd like to move to the fourth resolution, which is Resolution D, award of bid to relocate the existing fuel farm from the Ithaca Tompkins Regional Airport, and that's ID 9289. And I move that.
May I have a second? Dave McKenna?
Yep.
Sorry, Annie, Dave was faster on the draw than you were. Any discussion on the award of bid? As Deborah teases me with her dinner. All right, roll call vote. Here we go.
Shauna Black,
No.
Amanda Champion,
No.
Deborah Dawson,
Yes.
Henry Gramison,
No.
Rich John,
Yes.
Anna Kellis,
Yes.
Dan Klein,
Yes.
Ann Corman,
Yes.
Mike Lane,
Yes.
Dave McKenna,
Yes.
Glenn Maury,
Yes.
Martha Robertson,
Yes.
Mike Sigler,
Yes.
Leslyn McBean Claiborne.
Yes,
We have 11 ayes, 3 noes.
that passes. Thank you very much. Any other questions for Mike? Anything else from you, Mr. Lane?
I just wanted to mention that I attended the ITCTC meeting. That's the Ithaca Tompkins Transportation Council meeting today. It was a joint planning and policy committee meeting. And with respect to the DOT facility, they're making good progress. The state told us that they expect it to be completed before the end of the year, including they expect it to be completed or mostly completed by September, and to begin moving from the inlet and have that accomplished by the end of the year, when they should be able to go to bid to sell the property that is on the inlet. So that's moving right along. They seem to be happy with the contractor, Streeter Associates, who's doing the work. I just wanted to tell everybody about that.
Thank you. Any other questions? Yes, Dave?
Yeah, I just wondered, Mike, do you know how they're planning on coordinating the fuel usage in the interim between the time our facility gets built and so on and so forth?
Are you asking me or Mike Hall?
Either one.
I'll defer to Mike Hall and see if he knows. I don't know the answer.
I missed the first part of that audio, but if the question was where are they getting fuel, the answer is with the WEX cards. You can, we have fuel credit system, and you can use that card to purchase fuel, from any fuel outlet. So I believe that's the answer to your question.
Okay, thanks, Mike.
All right. Anything else for either Mike Lane or Mike Hall? Okay, thank you for your report, Mike.
Well,
thank you, Mike Hall, for sticking around. Government Operations Committee, Amanda Champion, Chair.
Thank you, Leslyn. We will be meeting this Thursday, the 7th at 1:45. We will have updates from the Tompkins County Public Library, as well as the Board of Elections. And we will have a discussion about our redistricting situation, with hopefully narrowing down our options at that time to move forward and bring something to the legislature next month, maybe, hopefully. And that's it. Thank you.
Thank you, Amanda. Any questions for Amanda? All right. Planning, Energy and Environmental Quality Committee, Deborah Dawson, Chair.
Thank goodness I finished my dinner. So we met the 4th day of last month, and the only business we really conducted was accepting the plan, the ag district update that we will be having a public hearing on at our next ledge meeting. We will not be meeting again until day after Memorial Day. And that's my report.
All right. Any questions for Deborah? Thank you very much. Y'all are being crispy. I like it. Workforce Service, no budget, capital and personnel committee, Martha Robertson, chair.
Thank you, Leslie. Nothing going on in this committee. We met as an expanded budget committee last Tuesday night and heard a 4-hour version of pretty much of what Jason went through tonight. So that last meeting, our next meeting as the regular budget committee will be Monday, May 11th, next Monday at 3 o'clock. So I guess that is all a report. I do have that resolution that we added.
Yes, ma'am.
Okay, so if there are no questions, I would move authorize and direct the county administrator to carry out furloughs for certain identified county employees during the COVID-19 pandemic. So move.
Moved by Martha, may I have a second? Seconded by Anna. Discussion, please. You had a lot of discussion already on this one. No more?
Yeah, I would like to add a whereas to the bottom of page 1. 1, 2, 3, 4, 5. So it's after, whereas the COVID-19 pandemic is impacting sales tax receipts. I would add, whereas, although and I've emailed this to you, Kathy, during the break, so you have it in your box. Whereas, although the federal government has provided trillions of dollars of aid to individuals, businesses, and corporations, so far no support has been provided to local governments to replace the local revenue losses due to COVID-19, except for limited support for certain COVID-19 expenses and entities with more than 500,000 population. So if that would be friendly
to the seconder to add? If the seconder says yes.
Okay, thank you.
Martha, could you read that again, please?
What, Rich?
Could you please read that again?
Reread it.
Yeah, basically puts the lack of any federal support to local governments in the context here that this is putting in place, authorizing Jason to go ahead with the furloughs that we've been talking about. And it kind of adds that to the context so that it's really clear what's missing. So I can read
the language.
Whereas, although the federal government has provided trillions of dollars of aid to individuals, businesses, and corporations, so far no support has been provided to local governments to replace the local revenue losses due to COVID-19, except for limited support for certain COVID-19 expenses and entities with more than 500,000 population.
Thank you.
I saw this before and thought it'd be fine to add it.
All right, it was friendly. And any objections? No. All right, let's vote on this one. Thank you, Martha, for that.
Yeah.
Shauna Black,
Yes.
Amanda Champion,
Yes.
Deborah Dawson,
Yes.
Henry Grandison,
Yes.
Rich John,
Yes.
Anna Kellis,
Yes.
Dan Klein,
Yes.
Ann Corman,
Yes.
Mike Lane,
Yes.
Dave McKenna,
Yes.
Glenn Maury,
Yes.
Martha Robertson,
Yes.
Mike Sigler,
Yes.
Leslie McBean Claiborne.
Yes.
14 ayes, 0 noes.
Anything else, Martha?
That's all I have. Thank you.
All right. Thank you very much. Moving along to Workforce Diversity and Inclusion Committee, Ann Corman. Anything from you, Chair?
Thank you. Just briefly, we haven't met since last time. We'll be meeting on Wednesday, May 27th at 3:30. And one of the topics I'd like to discuss then, and just to put this out there, is when things like this happen, a pandemic or a recession, things that are this severe to our communities, people that are vulnerable populations are impacted more severely. So as we are considering what we are going to do to help the community to reopen, please consider things like that, such as people of color were less likely to get the small business administration loans. And this just goes on, a ripple effect through our community. So thank you.
Thank you, Annie. Any questions, Ian? Wonderful. Tompkins Intergovernmental Relations Committee, Martha Robertson, Chair.
Thank you, Leslin. We will meet tomorrow at 11:30. And we were able to get three very interesting folks to be able to join us. Amanda Spellacy, regional representative, who's our source of so much of our information. She'll be on the phone with us at 11:30. And from Cornell, Diane Miller, Cornell's public affairs person in Washington, and Charlie Krasansky, Cornell's person in Albany. They're both going to be on the phone with us. We'll probably go into a little bit more of what's going on with the federal bills and the state budget issues tomorrow. And then I would like to have at least a beginning of a discussion of the goals of the committee. Since this is a new animal, I would look forward to a sort of an open-ended conversation among committee members and anybody else who is interested and able to come to. So that's my report.
Thank you. I'm glad that the Tiger is meeting. Yay.
Thank you. Thank you.
You said 11 o'clock?
11:30.
11:30.
11:30.
Yeah,
okay.
And I still keep thinking, yeah, we're meeting in chambers. No, we're meeting just like this. So.
11:30 in little square box, rectangular boxes. Got it.
Thank you.
Housing and Economic Development Committee, Anna College Chair.
I'm gonna unmute without the space bar. We met, can't coordinate too many things at once. We met about a week and a half ago. One of the resolution that was added was a big part of the agenda. There's only one other thing that I wanted to mention because it is a bright and shiny, nice piece of news, I think, that can lift people up, or at least I hope it will. But the Planning and Sustainability Department identified funding, CDBG funding, community development block grant funding that we normally have set aside for renovations for buildings that has been administered by INHS. Because we can't go into people's houses right now, we can't use that money for renovations. So they have been in connection with the state, and it looks like we haven't gotten confirmation, but it was a back and forth with the state, and they seemed very receptive to using that funding to create a fund that would pay for 3 months of rent for people who have been severely impacted by COVID. So I know, a lot of us have been really worried about people being evicted from their houses if they haven't been able to maintain their rent during this period of time that we are in a moratorium, an eviction moratorium, the moment that that's lifted. So the hope is that this can stabilize some of the people who've been severely impacted so that we don't see that wave come at the end of this. So that is in the process of happening. The city, they're working, or we county are working in collaboration with the city. The city actually has a public hearing tomorrow night to use CDBG funding to create a parallel program. As you know, our funding would not be allowed to be used inside the city, but the cities can be used only in the city, so it would cover the entire county. As soon as we know, we'll certainly let everybody know. That could be, I think at this point, it's about 600,000. Once we use that down, the hope is that we could then have access to or apply for new CDBG funding to go into this program. So we'll keep everybody up to date on that. And the second is the resolution that I brought forward. And I would like to move that.
Before you go there, Anna, I just want to ask if there were any questions on what you, on the report you just gave.
Sure.
Okay, thank you. Go ahead.
Absolutely.
Resolution.
So this is the resolution urging the state to establish an emergency rental assistance program, S8140, and that's A10248. Those are the state bills in response to the COVID-19 crisis. I think this is resolution F.
Okay, move. I need a second. Seconded by Ann Corman. Thank you. Discussion. Go ahead, Anna, you had more?
It's pretty straightforward. I think the resolution is really clear. This is a bill that has traction from almost all of the housing advocacy groups at the state level. It has been submitted. The lead author was Kavanaugh introducing it in the Senate. And it would follow suit in the program like similar to the Housing Choice Voucher. It's a voucher program for those who've been severely impacted by COVID. And so people who are rent burdened over 30%, there's really clear guidelines. If anybody falls below that at any point, then they wouldn't be supported. That's to make sure that people who actually need it are the ones who are getting this, that don't already have rent assistance. So it's pretty straightforward. Again, it would be for 3 months, and it is currently at the state on the floor. So in committee.
Thank you. Questions on the resolution, discussion, anything else? All right, let's vote. Roll call.
Shauna Black,
Yes.
Amanda Champion,
Yes.
Deborah Dawson,
Are you still eating?
No, she's digesting now.
No. My cat knocked my little mouse down. Yes.
Thank you.
Henry Granison,
No.
Rich John,
Yes.
Anna Kellis,
Yes.
Dan Klein,
Yes.
Ann Corman.
I'm sorry, my cat knocked my mouse down here. Oh,
Is that a yes, Ann?
God.
yeah.
Anna, you're hilarious.
Getting late. Hold on, guys. Let's get through the roll call.
Mike Lane,
Yes.
Dave McKenna,
Yes.
Dave, did I lose you?
Dave,
Anyone? Ferris?
Bueller.
Bueller? All right, keep going.
Glenn Moore,
Yes.
I'm so glad someone got that reference.
Martha
We
Robertson,
gotta hear the votes. Hold on.
I'm getting punchy. Yes.
Mike Sigler,
Yes.
Leslie McBean Claiborne,
Yes. David's back.
Okay, I'm back. Yes.
13 ayes, 1 no.
Thank
You guys
you.
talk too long. My battery's dying.
The next HED meeting is the 28th at 9:30. That's Thursday. That's my full report. Thanks, everyone.
Thank you. That passes. Thank you, Anna. People have cats and mice and. All right, complete census count committee, Mike Lane, chair.
Monday, yesterday, as a matter of fact. And we talked about our continued effort to get out the word about responding to the census. We're over 50% in Tompkins County responses at this point. However, we're very under response from the students who are living off campus or are grad students, for example, particularly like in the college town area where we're only about 18 or 19% response for those. We were disturbed yesterday, and the Ithaca Journal had an article out of USA Today with misinformation saying that
the students who had gone home after being released from the schools were going to be counted at home. Well, that's not the case. Under the rules of the census, the students are counted where they are when they're in school on April 1st. And so these students are a part of our population count. And it's going to be difficult to try to get them out. The colleges have been working very hard to do that. Both IC and Cornell are sending out emails. They're sending out videos. They're trying to get the attention. Other parts of the county community are being asked to participate as well. We're hampered, as you know, because of the pause. Our rural libraries are closed so that we don't have the access there for people to come in and get help answering the census on the library computers. We've had a number of ideas from our PIAB, our Public Information Advisory Board, and others about advertising we should be doing. But things like putting ads on the Tomtran buses and things, we don't have a lot of people using those right now. So we don't know exactly how long the census will be extended. That makes a difference for us. It makes a difference, as Amanda will probably tell you, about the where we're going to end up for redistricting for certainly the county legislature and the city council. Some people have asked questions about, well, what if we don't get the full count and we don't, what kinds of money will we lose in the grants? And I just thought you'd like to hear this. Today at the ITCTC, the Transportation Council, it was brought up about the fact that if we don't get a full count, if we were severely undercounted, we could lose our MPO, which brings in probably an additional $2 million, $2.5 million a year into Tompkins County for transportation projects. I can remember back in 1990 when the MPO was created, because we just squeaked over the number of people you needed in what was called the urbanized area in order to have an MPO. And we were probably the smallest MPO in the country at that time. So there's an example, a direct example of how you can lose money if we were severely undercounted. Now, we've got some spread because I think you've got to have at least 55,000 people, so it's not too likely we'll get down that low. But think about those things that are dependent on the numbers of people in our municipality and why it's so important to keep them counted. Glad to answer any questions.
Thank you, Mike. Any questions for Mike? Make it crisp again, because Shauna needs to go to sleep. Martha, I see your hand up.
Thank you. Mike, I'm hearing from parents who've already, filled out their census with their kids at home. And there's no way somebody can change a report, right?
No, but I think the person could resubmit, at least for what I've read, and somehow the census is able to sort this out if I get a double response. So I would take say to them, if they've done it wrong, try to resubmit it.
Okay. Okay, that would be important, another important message to get out, because
Yes, indeed. Thank you.
Thank
And
you.
we'll definitely keep pushing. Any other questions to Mike? And census, we all have to just keep at it and reminding people to fill out the census forms and doing the best we can. Downtown Facilities Committee, Dave McKenna.
DTF has not met.
All right, Public Safety Committee, Rich John, Chair.
Thank you, Madam Chair. The Public Safety Committee has not met since our last legislative meeting. We are scheduled to meet on the 21st of May at 3 o'clock on a Zoom meeting. I anticipate we will be discussing the Labella Consultants study of the public safety building. And I also wanted to mention the census count at our jail is at 27 with 1 board in. And that's my report.
Thank you. Any questions for Rich? Did everybody get the Labella report? We asked for it last time. Everybody's good that they got it. All right. No questions for Rich. Thank you very much. No member filed resolutions, minutes of the previous meeting. May I have someone move the minutes? Moved by Martha, seconded by Rich. Any discussion of the minutes? Any changes? Martha?
Yeah, I emailed Kathy at the end of the day a slight addition to my report from the Tiger Committee. Just to mention that aid to state and local governments was not included in the bill that was mentioned in the report there.
Okay. Anyone else? Roll call votes of everyone in favor of the minutes.
Shauna Black,
Yes.
Amanda Champion,
Yes.
Deborah Dawson,
Yes.
Henry Grandison,
Yes.
Rich John,
Yes.
Anna Kellis,
Yes.
Dan Klein,
Yes.
Ann Corman,
Yes.
Mike Lane,
Yes.
Dave McKenna,
Yes.
Glenn Moran,
Yes.
Martha Robertson,
Yes.
Mike Sigler,
Yes.
Leslyn McBean Claiborne,
Yes.
14 ayes, 0 noes.
Thank you. That passes. Any unfinished business? All right. May I have a motion to adjourn? Moved by Shauna, seconded by Ann. Anybody not in favor of adjourning? Do I have to do a roll call for adjourning?
Nope.
No? We're all in favor of adjourning, yes. Okay, next time I need a little more pep from those of you who are sitting at home.
Yes.
Thank you, we're adjourned. See, Dan is here pepping it up with me. Have a good night, everyone.